In case all of us are prepared, then let me wish all of us good morning and welcome to our closing conference, Support to Ukraine for Developing a Modern Public Health System, which is implemented in Ukraine since May 2024 through May 2025, respectively. Today we'll be making the summary of our efforts regarding approximation of our healthcare system to the standards of European Union, elevated institutional capacity and development of effective public health system in Ukraine. And today our key event will be dedicated to discussion of the results, findings, and also discussing the future pattern of development once the project is completed. And today we're happy to welcome representatives of the EU delegation, Ministry of Health of Ukraine, World Health Organization in Ukraine, international organizations, Ukrainian specialized authorities, civil society and non-governmental organizations, as well as experts in the field. And also please be informed that we are broadcasting this event to YouTube. I have to inform you that in case the airstrike alarm sounds, we will have to proceed to the shelter, which is available here at the basement of the hotel. And thank you for making it on time for the start of our event despite of the airstrike alarm. And hopefully neither ballistic missiles nor cruise missiles will stand in our way to a successful event. And with that, I'd like to invite the leader or team leader of the program, a senior leader in the public health, Piotr Gadurich, to the welcoming address, and he will join us live online. And with that, good morning, and over to you.
Thank you very much. Ladies and gentlemen, our dear Ukrainian friends, after 6 exciting years, it's time to say goodbye. Our project has come to its end. During those 6 years, we managed to successfully provide technical assistance and support to the Ministry of Health of Ukraine, Ukrainian Public Health Center, Ukrainian Center for Coordination of Transplantation, together with the support of European Union Delegation of Ukraine, World Health Organization, Country Office, American Center for Disease Control and Prevention, and other international partners. Our technical support was provided from legal approximation with European Union policy and legal framework to support capacity building and strengthening of Ukrainian leading national institutions, to epidemiological surveillance, laboratories, blood safety, over to communication in public health area. With more than 150 engaged international and national experts, and with more than 150 different activities. Today we gathered to discuss sustainability of our project achievements, but also to discuss priorities for public health reform in Ukraine in the immediate future. We glory the success of Ukrainian government, Ministry of Health, Ukrainian experts and Ukrainian people towards European path. However, we are aware that it is still a long way in front of Ukraine with the final aim to achieve its full European Union membership, but also means accepting European policies and practices. I would like to thank you. I would like to thank the Ministry of Health Ukraine, to the Public Health Center of Ukraine and Ukrainian Coordination Transplantation Center. I would like also to acknowledge full support of European Union delegation in Ukraine and other international organizations. However, above all, I would like to thank the Ukrainian people for bravely fight for its European destiny and European future. Thank you, and Slava Ukraini.
Героям слава! Thank you very much. Дуже дякуємо.
And thank you so much. And with that, I'm happy to invite to the welcoming address the leading expert in blood safety, Mohammed Farouk, the professional who is the embodiment, to the greatest extent, of the reform in that sector in Ukraine. And just in case some of you didn't manage to collect a pair of headsets for the benefit of translation, please do so at the reception desk.
Ladies and gentlemen, Dr. Kuzin, Deputy Minister and Chief Sanitary Doctor, Mr. Steiner, Mrs. Diuta from the EU delegation, distinguished partners, friends, and participants. Good morning, Dobry ranok. It's my pleasure to be speaking with you today in the occasion of the end of our project. Usually, I feel very happy to give project end speeches because for me, they mean starting a new professional endeavor. However, in this project, I don't have the same feeling because after 6 years of project implementation, it's really a full life. It's not only the professional aspects. So this is one of the, let's say, hard project closure speeches that I'm giving. This project has been implemented over 6 years, during which we had 2 years for COVID-19. We have 3 years for with a cruel war. So you can see we have only 1 year of normal project implementation circumstances. However, in spite of such circumstances, the project achieved, and actually in some indicators, we overachieved. If I focus on the area that I am responsible for, which is blood transfusion, I can highlight 3 achievements that are really, during my professional life in many projects, we spent many years and we could not achieve stuff like this. First, we have a solid legal base for the blood transfusion system that is aligned with the EU requirement, largely aligned with the EU requirements. Second, we have a modernly structured blood transfusion system at the central level. So we have competent authority, we have central coordination body, and we have national blood transfusion committee. And third, the country moved quickly to rely, let's say, 100% on the voluntary non-remunerated blood donors, who are the most safe, the safest, and the most reliable source of blood. So with just these 3 achievements, I think the project overachieved in the blood transfusion area. And I would like to thank all partners, all international bodies, all NGOs that participated with us in the project. And I would like specifically to thank the Ukraine Blood Transplantology Coordination Center, UTCC, who was our partner for many years, and we had good collaboration. Of course, we had some fights, we have some hard times, but at the end, we managed to finalize everything and achieve. Finally, I would not finish my word without giving a very big thank you to my team, the project team, our assistants, our translators, our administrative team, whom without them, we would never have this project implemented. Thank you very much, and looking forward to meet you all during the networking time. Thank you.
Дякуємо, пане Фарук. Я долучаюся до ваших.
Thank you so much, dear Mr. Farouk. I'm joining your pool of appreciation in favor of the entire project team, but to make sure that nobody is left behind the scene, let us look at the short video which describes what this project is about.
Modernizing the public health system, reinforcing its resilience against unprecedented challenges while paving the way for integration.
Серед ключових досягнень проєкту – підтримка розвитку системи громадського здоров'я України у відповідності зі стандартами ЄС. Проєкт підтримав створення стійкої системи епідеміологічного нагляду за інфекційними та неінфекційними захворюваннями. Ухвалено 2 основоположні закони України – про систему громадського здоров'я та про безпеку і якість донорської крові та компонентів крові. За підтримки проєкту створено сучасну централізовану систему безпеки крові, яка гарантує безпеку та якість донорської крові і популяризує добровільне безоплатне донорство. Запущено різні електронні реєстри системи «Є-кров» для покращення координації та комунікації між усіма зацікавленими сторонами.
The transformation of Ukraine blood transfusion system has been a crucial milestone, securing a sustainable, safe and high-quality blood supply, improving governance and ensuring compliance with the EU standards.
Незважаючи на такі виклики, як пандемія COVID-19 і повномасштабне вторгнення, проєкт швидко адаптувався та забезпечив стратегічне реагування системи громадського здоров'я України. В рамках проєкту проведено 4 хвилі інформаційної кампанії для популяризації добровільного, безоплатного донорства крові. Понад 3 тисячі фахівців охорони здоров'я відвідали семінари, майстер-класи і навчальні заходи, організовані проєктом в Україні та країнах ЄС, що сприяло покращенню міжнародної співпраці та обміну досвідом. Досягнення проєкту в сфері громадського здоров'я та системі безпеки крові сприятимуть подальшій інтеграції України в ЄС.
Дякуємо ще раз всім, хто доклався до запровадження цих змін. Давайте поплескаємо, особливо враховуючи те, що багато
Accomplishments to happen. Let us share the round of applause in favor of the people. Most of them are sitting here in the hall. And also, I would like to invite René Steiner, advisor on migration and internal affairs, justice and consumer protection, healthcare and food safety, representing the European Union delegation to Ukraine. Dear René, the floor is yours.
Good morning, everybody, and thanks a lot for moderating this day. We're now having a tradition that whenever there's a very important health conference, Mariska is doing the moderation, and it's always excellent because she's a good timekeeper, so please throw apples at me when I'm too long. Because what I'm going to do now is to get back to Churchill. Churchill once said, if you have an important message to make, you take a pile driver. You hit the point once, you come back, hit it twice, and then you come back again and give it a huge whack. Sorry for the interpreters with this. What I'm going to do now is after, from the project leads and the videos, I'm going to give the third whack on the achievements of the project. Because this was the main driving force behind Ukrainian public health system alignment with EU regulations and standards, and the only big EU project that supported public health reform in Ukraine. There was a technical assistance given in the regulatory and in the legal sphere, and that brought Ukraine much, much, much closer to European policy and practices. And I can tell you, hold your breath, hopefully very soon, when the screening report, and ask me in the coffee break about what this means, will be published, you can see what Chapter 28 says about the areas in which the projects work. And I think there will be a good moment to open a bottle of sparkling wine. So, what were the achievements? Once again, there were 140 national, international experts engaged to provide technical assistance to the Ministry of Health, to the Ukrainian Public Health Center, and the Ukrainian Transplant Coordination Center. The project was the biggest advocate for setting the UPHC as the leading public health institution in Ukraine. And this was recognized also by the work of Narada, by the adoption of the law on public health. There were around 50 educational activities carried out with more than 2,000 Ukrainian participants. There were around 200 activities in the areas of public health, starting from legal and regulatory framework, capacity building, epidemiological surveillance, non-communicable diseases, obviously blood donation and blood safety, public health communication, public health laboratories, and the COVID-19 response. And of course, this all had to come with some financial and administrative management. And let me pause here a second and let me thank you, the colleagues from the involved organizations who sitting behind the screens and making sure that all the Excel tables get filled in on time and that all the audit certificates are there, because they're often forgotten. But these are the people who actually allow the experts to do the work. So a big thanks to those colleagues as well. And as we heard, 6 years has been a long time. Some of those have changed. So we hope that they're now watching and are proud of what they achieved. Back to the subject. The idea of the project was that the public health reform should be based on evidence, not on hearsay, on hardcore facts. And we think that has been very much achieved. In particular, as a lifelong blood donor, I was very happy to see the approval of the new blood safety law. That happened actually at an early stage of the project. And this not only helped going Ukraine towards the EU, but it's also a solid legal base for improving blood safety in Ukraine. Of course, implementing such a law is a lengthy process that goes beyond the lifetime of the project, but we know that Ukraine is committed to implement this. And a great thanks also to the Ministry of Health in this respect for supporting all these efforts also beyond the project. And of course, we are always ready if you want to discuss some aspects with us, if something still needs to be done. What I think should be highlighted, and that's the huge fact that Churchill mentioned, is the shift from paid blood donors to voluntary donors, non-remunerated. Because voluntary donors are much more safe and more reliable. So this is a huge sea change. And for those who want to learn more, I really encourage you to speak to our blood safety experts here in the room. He can tell fantastic stories about dozens of regulations and bylaws and secondary legislation that had to be changed to have it in one compact base to allow all of us, and I hope it will never happen, but if we need a blood transfer, that we can feel very, very safe. So finally, what is actually the proof of the pudding? It's eating it. And unfortunately, the situation provided us with this proof, because neither the civilian and military bloods needed blood imports from abroad, but the Ukrainian blood system was ready and proved for the last years that it's self-sustainable. On that happy note, as Mohammed said, this project went beyond the ordinary. People have become friends. And this is good like this. And I want to give you the chance, we want to give you the chance to even make more friends. There will be a blood donation opportunity, and there is nothing better than lying next to somebody you haven't known before, who is from the area, so that you can talk a bit about your work and do something good. So on that very happy note, encouragement to use the lunch break to donate your blood. Thanks again to everybody for the support. And wish you a day where we will all get out with eyes open and saying, wow. Thank you very much.
Rene, thank you very much for this wonderful presentation and for inspiration for those who want to make a donation during the lunchtime. Друзі, подумайте про тему.
With that, indeed, dear friends, please consider using this time and enjoying this opportunity to donate your first blood. And with that, I'm happy to invite Mikhail Rdutsky, Chair of the Health Committee under the Verkhovna Rada of Ukraine. Please take any microphone, and with that, you're welcome to the floor. Yes, good afternoon, good morning, my dear friends. This is my pleasure and honor to be here with you in order to express our appreciation to European Union to start with, for the benefit of standing here side by side with us. First, during the time of the pandemics, over the time of pandemics, and then at the start and over the time of the full armed aggression that the terrorist country of Russia is running against Ukraine. And again, this is not just aggression against Ukraine. This is aggression versus the entire European Union. And that clearly demonstrates that Ukraine, as a member of this pan-European family, is not left on its own facing the challenges that we currently have. As of today, the agenda that we have in front of you was set under the framework of this project, which was not only a very strong element of the public health system, but also an element in securing the blood safety system, donor blood donating system overall, which is a very important element of the set of Ukrainian legislation, which has been finalized to the great extent, remembering also the secondary and executive regulations, which were drafted and endorsed by the Ministry of Health to make sure that this legislation actually works. Also, benefiting from the support provided by the World Health Organization in Ukraine as well as European Commission, we have endorsed the program and the strategy of health development in Ukraine through 2030, and also looking into the most recent home task checks in the field of public health. We via different reviews and assessments conducted by the European Union committees and authorized agencies, we are ranking at 82% of preparedness and compliance with the European legislation. There are other areas which are also important enough, but none of them has been improved to the extent like in public health sector in particular. Speaking of advocacy for legal changes, for executive changes taking place in the health sector, we have been experiencing how important that would be. Now, I have to admit, we are entering another challenging area, which is reform of the pharma manufacturing sector, which again would be following up on the direct on the directives provided by the country leadership. The president himself appreciates how important that is, and we understand how challenging that might be. But again, benefiting from the EU support, European Business Association taking a stake in that, appreciating how difficult but promising that could be. And we can definitely see that some of the compromise-seeking and achieving efforts are providing us with the opportunity to better balance our health sector reform. And our expectation is that starting with the month of May, the manufacturers and distributors will benefit from that, but most importantly, the patients will also become direct beneficiaries of such developments. Also, Ukraine is accessing the Polar system, which will enable us to access the generic medicines, which currently are quite limited in terms of the accessibility due to some imperfections, which are again associated with the Polar compliance, in order to make sure that Ukraine can access the market of generics just like other European Union countries. And again, starting on the 1st of January 2027, maybe WHO will not be happy because of that, but Ukraine will have established the National Stringent Monitoring and Authority, the Ukrainian Medicines Agency, UMA, because all of the preparations have been completed as of today. I mean, the training, institutional development, and other fundamental processes have been adhered to, making sure that Ukrainians have access to high-quality medicines, high-quality equipment, high-quality consumables as well. And this, again, is one of the elements of evidence of our successful implementation, which will be granting solid access for Ukrainian manufacturers, retailers, and patients, once again, to European market opportunities without any additional budget. Begging your pardon on that. Without any additional public budget allocations in the field of product registration. And this will be also covering the countries which already have established stringent regulatory authorities and policies. And we have no doubts that we will join this European family. But as of today, we are also negotiating with the sovereign committees, sovereign legislation bodies of different European unions about mutual recognition of GMP, GDP, and JPP certificates, which will provide us with the barrier-free access of patients to the state-of-the-art technologies, including medicines. On top of that, Ukraine is regularly increasing the health budget, and in our communication consultations with WHO and European Union representatives, we do understand there is some difficulties in terms of reimbursement for medicines. Definitely, there is some financial hardship experienced in the country, but nevertheless, we have increased the reimbursement budget under the program for affordable medicines, with a total allowance exceeding $500 million of Ukrainian hryvnias additionally to the previous budget. And also, we'll be making sure that all of the medicines, except for innovative commodities and branded medicines, but all of the generic medicines will be priced following the reference pricing estimates, now taking into consideration the price range in at least 4 European countries for the benefit of such benchmarking. Another important area would be immunization. The immunization plan, which was updated quite recently, again with major support from WHO and European Union, making sure that we include new items instead of reducing them from the list of planned immunizations. Human papillomavirus, for example, is important enough to be recognized as an accomplishment in order to improve the statistics in such complications as cervical cancer, for example. And today we can see how productive would be the experience of Australia and other countries, because HPV immunization provides for substantial health benefits and security of patients. Further on, Ukraine, benefiting from support shared by European Union and WHO, is in the final stage of developing the biosafety legislation, because our current challenges are definitely emphasizing importance of having the respective securities in Ukraine when it comes to biological threats, and unfortunately nuclear threats as well. And in that respect, we are updating our legislation. Hopefully by the end of this year, this bill will be finalized with the support from WHO and ready for endorsement. We have other similar initiatives and also coordinating them respectively with European Union structures. The DG Santé, for example, is our standing partner. Again, we cannot disclose all the secrets and the dates, but we are planning joint session of both our committees. Also, we have very productive cooperation with Bundestag, Health Committee of the Spanish government, which is helping us to elaborate and improve the respective legislation, which would be not only compliant with the EU acquis, but will be based on starting with the earliest development efforts on the same values and principles, making sure that such harmonization is intensified. And again, we are also thankful to our bilateral partners, including the European Parliament, Member States, and World Health Organization, on account of standing side by side with us and never leaving us on our own. But at the same time, I'd like to particularly reiterate that we Ukrainians appreciate the kindness and support. More importantly, we are fully committed to make sure this is reciprocal. And we have very good memory. We do remember all of the good things done by our partners, and we really appreciate and will pay it back. Thank you so much, dear Mikhailo. I hope you have enough time to stay for the benefit of our panel discussion, because I'm sure there will be multiple questions. So please, dear participants, take note of your questions to have them presented during the panel discussion. Anna Desai, you're welcome to the stage for the benefit of the welcoming address as well.
Ladies and gentlemen, dear Mr. Raeldutsky, dear Deputy Minister Slobodnichenko, dear Deputy Minister Dr. Kusan, dear Mr. Steiner, dear Ms. Zeduk from the European delegation, distinguished project partners and experts, it is a great honor to speak to you on behalf of GFA Consulting Group today as we mark the conclusion of this project, which we have been part of during the past 6 years. We had the privilege of implementing this project together with THL, the Finnish Institute of Health and Welfare. After 6 years of cooperation, I'm standing here with deep admiration and gratitude. It is a moment of reflection, and I would surely especially like to thank, of course, the EU delegation for entrusting us with this work and with the responsibility with this goes with it together. Looking back, though, we are mostly truly impressed by the way the Ukrainian public health authorities and partners have cooperated with us and have utilized our technical advisory services. I think the results speak for themselves. The short video has shown it, but I would like to reiterate it once more. The blood safety system in your country has been restructured and transformed into a truly modern, centrally and safe system. The UPHC has been consolidated and operates now in a very scientific manner. Numerous laws, strategies, and guidelines have been aligned with EU requirements. And more than 1,500 healthcare professionals have been trained, and I am sure they will carry this work forward in the years to come. And what makes these accomplishments even more extraordinary is the context in which it has been achieved. Yes, it has been mentioned earlier by the other speakers, but it is important to say that the COVID-19 pandemic disrupted the work of experts and also diverted critical resources. And then the invasion by Ukraine in 2022 fundamentally changed the lives of many Ukrainians, of many of you. But what never changed and what never faltered was the determination of our Ukrainian partners in taking this project forward. And I would like to point out also in the brochure Minister Liashko said, who reminded us that European integration is not only a strategic choice, but it is a truly transformative one, reaching out into every corner of public life and, of course, also for the health sector. This project has been a deep inspiration for us at GFA, and we saw neither a pandemic nor a war could stop the will to reform. This is a legacy in itself. Let me all thank you very much, and thank you for your trust and your cooperation.
Дякую, пані Десаї. Я хочу залучити
Thank you so much, dear Madam Desina. I also would like to invite another online participant, Juha Rum, from the Finnish Institute for Health and Welfare, one of the leading partners in implementation of the project. With that, you're welcome.
Thank you. Dear ministers, dear deputy ministers, head of the Health Committee, representatives of the EU delegation, World Health Organization, Director General of the Ukrainian Public Health Center, dear Ukrainian and German colleagues, dear distinguished guests. Greetings from Helsinki, Finland. Thank you for this opportunity to give this speech on behalf of the Finnish Institute for Health and Welfare, THL, in this closing conference of our joint EU-funded project, Support to Ukraine for Developing a Modern Public Health System. Finnish Institute for Health and Welfare has been a partner in this EU-funded technical assistance project led by GFA Consulting Group since the very beginning of the project in May 2019. As a governmental research and expert agency specializing in health and social policy, in Finland, THL plays a crucial role supporting the Finnish government in evidence-based policymaking. In this capacity, THL serves as a peer institution to the Public Health Center of Ukraine. In this project, the role of THL has been to support the leading partner, GFA, in the implementation of the project and its activities. Throughout the project, THL has supported the project by providing technical expertise under Component 1, which is support for the consolidation and empowerment of the Public Health Center of Ukraine, and under Component 3, which is the communication and visibility. Due to the Finnish administrative framework, activities under Component 1, which is supporting the creation of a modern blood safety system in Ukraine, do not fall under THL's mandate. Little did we know in the beginning of this project what was going to happen in the world. The implementation of this project has taken place under extraordinary and demanding circumstances. Shortly after its launch, the global COVID-19 pandemic reshaped international collaboration, and in late 2022, the full-scale military aggression against Ukraine further intensified these challenges. Unfortunately, due to these challenges, very few of our experts were able to visit Ukraine and meet their counterparts and colleagues on site face-to-face. Despite these obstacles, the project partners, THL, have remained committed to their mission, adapting swiftly new ways of working to remote collaboration in place of on-site visit and direct engagement with Ukrainian colleagues. Despite these extremely demanding external circumstances, the project has demonstrated resilience, transparency, and adaptability. The collaboration between THL, GFA, and other partners has remained strong, reflecting a shared commitment to supporting Ukraine's public health system under difficult circumstances. These kind of international development projects bring together not only the beneficiary country institutions and the EU member state institutions, but also institutions between the EU member states. I think we established excellent and complementary cooperation with our consortium leading partner, GFA. While focusing on the substance and technical matters, like in this case, public health and blood safety, one thing which is very often neglected or perhaps even forgotten is the role and development of public administration. It is the task of the public administration to develop and implement public policies, like in this case, for instance, public health policy. A well-functioning public administration plays a crucial role when developing and implementing public policies. It's good to keep in mind that one of the EU membership criteria is that the acceding country has the administrative and institutional capacity to effectively implement the acquis and ability to take on the obligations of membership. This basically means having a well-functioning public administration. As we have seen during the past couple of years, the challenges we are facing today are of transboundary and global nature. These challenges do not respect national borders. No state, let alone a single public health institute, can solve these challenges and problems alone. Therefore, we need international cooperation to tackle these issues which affect us all. We need to join forces, exchange ideas, knowledge, expertise, and information between experts. I always say that these projects come and go. but the contacts, networks, relationships, even friendships established during the project will continue after the project. And here I quote a famous movie, Casablanca. This is not the end, but rather this is a beginning of a beautiful friendship. Finally, I would like to use this opportunity to remind you that the next European Public Health Conference will be organized in Helsinki this year, in November this year. You are warmly welcome to Helsinki to participate in this conference. Thank you and Slava Ukraini.
Дякуємо дуже. Героям слава.
Thank you very much. Glory to Ukrainian heroes, glory to Ukraine. Thank you very much, dear speakers, for your welcome speech. And we're quite ready now to engage our audience, maybe to ask some questions. Therefore, I would like to invite our speakers to our first panel discussion. Jesus Perez Formiga, my co-moderator.
Запрошую так само Михайла Радуцького.
Mikhailo Radutsky, welcome. I promised he will get back, and he is coming back, head of parliamentary committee. Jarno Habecht, head of WHO country office in Ukraine, and also Mr. Kuzin, Ihor Kuzin, the chief sanitary doctor of Ukraine. Mikhailo, do you mind if I ask you to switch places with me? I would like to take a seat here closer to the co-moderator. So the topic of our session of discussion is the joint work, the joint project in Ukraine. We have heard about the main achievements, the two main laws which were enacted back in 2023, and the law on safe donorship and blood products that were approved in 2020. So what were the challenges, how it worked, how you managed to do that, what are the perspectives? This is something we would like to speak about.
Who's been online with the Ukrainian partners over the past years. It's your first visit directly to Ukraine, but you're very much into this subject.
Okay, thank you. Thank you very much. My name is Jesus Perez Formigo. I'm from Spain. I'm an epidemiologist and public health expert, and I've been involved in this project, not for a whole life of project, but for almost 3 years, always remotely. But I'm really happy to meet you in person here and be here. And thank you very much.
Я, напевно, зараз speakers, пана Михайла Радуцького, ще раз нагадаю, що це голова медичного...
Mikhailo Radutsky, let me reiterate. Starting from 2019, he is the head of parliamentary committee. That was his period in the parliament, in which lots of decisions have been made in the parliament, and they need to comply with the European standards and regulations, especially since we signed the European Association in 2014, and then we proclaimed our aspiration to become the EU member state, which of course means we need to synchronize Ukrainian legislation as much as we can.
He's the WHO World Health Organization representative and head of WHO country office here in Ukraine since November 2018. He has served also as a WHO representative and head of WHO country office in the Republic of Moldova from 2011 to 2015. Also in Republic of Kyrgyzstan from 2015 to 2018. Previously, Jarno served as a health specialist for the Estonia Health Insurance Fund, as a consultant and research for various health projects and health information initiative of the Department of Public Health. He holds a diploma in medicine and also a PhD from University of Tartu, Estonia. Over the last decade has authored around 50 peer-reviewed journal articles and books. Also continue with the Ihor Kuzin, is, as you know, the Deputy Minister of Health of Ukraine. He's an epidemiologist. He has also a Master of Public Health, Master degree in Public Management and Administration, and in specialization in organization and management of healthcare in epidemiology. He has a long list of background and position, but the last one was in 2021 elected vice chair of European Network of the International Association of National Public Health Institute, and also he's the national contact person for surveillance in Ukraine for the European Surveillance System, TESI. He's a member of a European Tuberculosis Research Initiative with the EuroWHO in Copenhagen, also International AIDS Society, and he's a member of the scientific board of the project Collaborate Action Against HIV in the region of Europe. And he was awarded the certificate of appreciation of the Ministry of Health in Ukraine in 2015, the certificate of honor on Verkhova Rada of Ukraine in 2020. Thank you.
Дуже дякую.
Well, thank you very much indeed for that.
Yes, as your colleague, I think it was Mr. Farouk said that over the 6 years, maybe 1 year was normal, so-called 2018, when we didn't have COVID, when we were not plugged into the pandemic that happened with the whole world. Then it was the full-time scale invasion. Does these circumstances make you, or make your work, or make your office of the World Health Organization in Ukraine the most challenging as compared to other representatives in other countries?
Thank you. And first of all, thank you for including World Health Organization also to the panel. And I really want to congratulate everybody who have been part of this project and initiative. And I started to think back what happened in May 2019 when we launched the project. And I didn't really remember everything because exactly what you said, there have been so many things between the May 2019 when you launched the project and then where we are today. I think in the world, we have many challenging places. So I think what we do in Ukraine and what we have is not the most challenging, but what is clear, COVID as well as the full-scale invasion since 24th of February 2022 it has put public health under immense pressure. And I believe this project, as many other initiatives, being very adaptable, have helped Ukraine public health specialists to respond in the best possible way. You asked about 2018. If I remember correctly, and Ihor can correct me later on, in 2018, we were busy with something else in Ukraine. We were closing the world's second largest measles outbreak in Ukraine. And we managed to close it down just before of COVID. So 2018 and 19, we were very, very busy on actually responding. And many of you actually around here also worked very hard to close down the measles outbreak. So that is also something that is characteristics for public health colleagues throughout the history of Ukraine. We always have something in our hand. So is it a measles outbreak? Is it actually preventing for the next outbreak? Is it ensuring that there is clean water? I think public health colleagues are majority of the time working behind the scenes. We don't know about them, but they play a very, very important role to keep the society together. So I hope that there will be many other questions coming on this way as we are discussing in the panel. But I just wanted to highlight one very important contribution of this project, along with the specialists, is that we have the public health law now in place. And what the THL colleague from Helsinki was mentioning on building institutions. So I think if we have a good, strong public health law with the strong institutions like the regional public health centers, and many of you are coming from the regions or you are coming from Ukraine Public Health Center, that plays a very, very critical part also for Ukraine to keep Ukraine safe, but also getting Ukraine towards the European Union. And I hope that the networking that you have done gives also you the opportunity to engage with twinning, to engage with many other initiatives that we have in Europe. And what is also very, very important is these strong institutions to have in Ukraine then can collaborate with other public health centers. And that is really a critical cornerstone for EU accession. So we can debate with René and the colleagues from European Union over the coffee breaks the importance of legal approximation, but then very, very important, at least what I have learned seeing Estonia before and after EU accession, is also how the institutions are working. That actually, though it's not only the legal part, but actually that all the legal agreements are put in practice. And that makes actually people safer. So back to you, and probably there will be more questions and debates during the day.
Дуже вам дякую, особливо за згадку про пандемію кору. Це
Well, thank you very much, especially for reminding us. Thank you very much, especially for reminding about the measles outbreak. That brings us back to some good old times when the pandemic of measles was just a good thing.
And one question for Ihor Kuzin that regarding the Ministry of Health is are the main challenge in the implementation of the public health law?
Oh, thank you very much indeed for this question. I feel it is a bit easier for me to answer this question because I used to work in the Ukrainian Public Health Center before. I was the one who piloted this philosophy of public health as a common worker to the UPHC, and then I switched to the ministerial position. But let me tell you the following. I think the project has encountered a maybe the widest list of challenges it could ever find in life. The global pandemic, the large-scale invasion, all it happened just in a 6-year period of time. These are huge challenges, not only to public health, but also to the system of blood donation. We know that safe, high-quality blood in a necessary amount, it is always needed. It is always demanded, both in the rear and in the front. And definitely the public health system, which is operational in Ukraine, it is encountering very many different challenges. Since the beginning of the project, we bumped into the global COVID pandemics, and just as all other countries over the globe, we had to provide a very rapid, a very efficient response. After that, we came across cases of terrorism, which we see quite often during the warfare, during the hostilities. Rapid response on behalf of the public health system, let's say after the Kakhovka Dam destruction in the Kakhovka area, proved that the public health system in Ukraine is capable of rapid and effective response to any challenges in the field of public health in Ukraine. What else do we come across very often as a ministry and the public health system in general? Well, let me call it political turbulence. Luckily, I would have, for the most recent 5 years, you don't feel it, I could say, and that makes me happy, because before that, at the stage of project design, many people thought this type of risk could be very essential, that could significantly impact the modality of the project implementation. One more important thing that I would like to mention is that, in my mind, the project actually a kind of advanced a bit quicker than we thought. I mean, not many people realized what Euro integration was about, what the country has to do in order to be integrated into the European Union. So when the project was being launched, it was not quite clear, even for the professionals in this field. So I guess every project needs to have a rather important component dedicated to promotion of European values, of European related information. I would like to use this opportunity to thank the team which spent 6 years of fruitful cooperation with us. You basically paved the way for us, at least in these several very important pillars. And I'm quite reassured, and I can say that the blood donation system in Ukraine is safe and effective. The public health system in Ukraine, well, we have tested all the approaches suggested by the project, and we may confirm that the public health system in Ukraine is capable of rapid response and effective response. So very much with gratitude. Can I ask you a question? In many fields, when the large-scale invasion started, people were quite, grateful that they, managed, they learned how to survive over the COVID times. I mean, education, some other fields. How did COVID help you to prepare better for the warfare? Well, that's a good question. We have analyzed some of experiences that we had. And let me put it this way. The healthcare system in general in Ukraine learned how to quickly manage resources. I think that was the key point, the key task, redistribution of care, redistribution of assistance or materials, increasing the number of beds, cutting down the number of something else. I think, so it's mostly about the redistribution of materials. So probably, we're talking about the fact that both the public health system and the healthcare system in Ukraine, they introduced this very rapid, redistribution of resources, which was the pivotal point, I guess. Number 2, during the COVID times, we have developed quite a number of different mechanisms of responding to different emergencies. Starting from staff or staffing, procurement, quick managerial decisions, different algorithms, and all these experience, it was basically used, it was transferred into this wartime period. The blood donation service, it was not heavily involved into these activities during the COVID time, of course, but the time of response, the way they adapted was really fantastic. We could understand from the very first days of invasion how much blood we have, where do we have it, what do we need to do to transfer it, let's say, a piece or a unit of blood to this or that area. So you're quite correct. It was a positive experience learned from COVID that enabled us to better respond to the invasion. Are we still in the process of learning? Yes, because every new challenge brings us to the new lessons learned. We test the old experiences. We double check if it is still operational. And just like every country, I'm quite reassured that Ukraine will be able to learn based on its own experience. Let me ask you one more question. Why, out of all cataclysms and tragedies that ever happened in Ukraine in the recent 3 years, why did you mention Kakhovka Dam destruction as a challenge for public health? Well, to my mind, that was the largest scale tragedy and event during this war, which brought to really extensive negative consequences and potential impact to public health. It's not a secret, I guess, to anybody that in Kherson Oblast, just as in many other regions, we have deficit of staff And this is true for healthcare system and the public health in general. So this massive tragedy, this ecocide, it not only impacted and challenged the safety of Kherson Oblast, but also the other neighboring areas. And to me personally, that is a very good example of rapid and high-quality response activities. I can also provide you with a couple of other examples. On the background of these hostilities, we also had to respond to a polio outbreak. There was assessment conducted, and there was a confirmation that we performed successfully. We closed that case in the territory of Ukraine. We also prevented the measles outbreak, and on the background of very high rates of measles in the European countries as well as the US. Well, we could observe some increase in the rate of morbidity, but that was not, it did not turn out to be an outbreak. Of course, the biggest part of this success belongs to our public health colleagues, and some of the information will be known after the war, after the victory. And nevertheless, this experience that we currently get, that is definitely useful, including it could be useful for the European countries.
For example, in regards of the legislation and priorities, what legislative priorities in the Health Committee focus in reform of the strengthened Ukrainian healthcare system in this post-conflict context? Thank you.
Дякую за запитання. Ну, я вже трошки на початку сказав, але...
Well, thank you very much for this question. I touched upon that a bit in the beginning. And the large-scale invasion right after the global pandemic, and come on, let's be frank, the pandemic was not over and the war started. I have to admit, we had a huge amount of challenges. And I'm not talking here about regulatory framework. Ukraine was not very ready for that. So we had to change our attitude. Based on the estimations from the WHO, we expect to have at least 2 million of people with PTSD problem. Well, this is the figure we have as of today, but the hostilities are not yet over, remember that. So we had to come up with some new regulations regarding the mental health. And I would like to use this opportunity to use the First Lady for her leadership in this field. So the Parliament adopted the new law on mental health. And now we're waiting for some bylaws to be developed soon. And that is producing a very new system for mental health in Ukraine.
And indeed, we have to admit that mental health among Ukrainians has always been perceived as something which requires psychiatric care and attention. Nobody thought about the importance of going to a counselor, to psychologist first. And again, PTSD by itself is a very major threat and challenge. And this is exactly why, appreciating such importance, we passed that law as soon as it became possible. On the other hand, we do understand that the war, which is ongoing in Ukraine, is striking Ukrainian economy very hard, in particular the purchasing capacity of households. And here we also have to better understand and decide how can people access high technology and high quality treatment and care opportunities. And again, the managed entry agreements are also allowing Ukraine to procure using special pricing when it comes to medicines and other health-related commodities. And these are positive advantages of this legislation put in action and the respective procedures which are put in place. Soon enough, Verkhovna Rada of Ukraine will be voting on making sure that such controlled market agreements will be available also to local budgets, relying on the funding disbursed by the national operators. Also, when it comes to alternative or parallel import operations, you do remember the fights that we had both in the committee and also in the parliament when it comes to opening such opportunities to high quality medicines, which is required in a timely manner as well. Also, remembering that during the time of war, at the time of disaster, there are different manifestations, how to describe it, poor quality, non-ethical business performance, let me put it that way. And we observed that a number of times our partners have emphasized the incidents when so-called biologically active additives were sold as drugs, while in fact they are not. And we are thankful to the European Union setting that as one of the particular items in our home task to deliver, because such additives were not recognized in line with the latest legislation, making sure that we are not wasting patients' money to buy substances which are marketed as drugs, while in fact they are not. And also, our expert service, our inspections were identifying sometimes the biologically active additives with active ingredient having 500-fold excess of the active ingredient as compared to the active drug. So again, this is one of those items which we have to keep in the list of items for discussion. Another challenge that Ukraine is facing is the reform of medical examination and certification commissions. Yes, this is important because we still were reliant on the post-Soviet style, actually Soviet-style obsolete system when it comes to disability certification, particularly in case of servicemen who had to queue up at the doorstep of such commissions for 2 to 3 months, and then being recognized as fully able and capacitated person while having amputations, and they were forced to go back into the battlefield for the benefit of recertification at a military hospital. And also, there were multiple cases when certain body functions are fully dysfunctional. Yes, it's not a prosthetic device, but the extremity is fully dysfunctional, and respectively the expert at the commission is not certifying such cases disability because this is not an amputation. And definitely this is non-acceptable practice, particularly in relation to our servicemen, to defendants of our countries. And not just servicemen, but civilians as well, seeking help in case of disability. I believe you were well informed about all of those corruption scandals, whether you take Khmelnytsky Oblast as an example. Well, again, this was not an exception. This is the matter of practice and rule. And that's exactly why the reform of Medical and Sanitary Examination Commission at the 35th year of Ukrainian independence, when we actually abolished this Soviet-style rudiment. And now we are launching electronic document management when it comes to disability certification. But coming back to the pharma sector, in Ukraine, like in European Union, like in other civilized countries, we have introduced a prohibition on any kind of pharma products promotion by healthcare providers, because we understand that patients, they do rely on the advice given by the healthcare provider. And if some clinician is advertising nicely one particular brand, one particular product, I believe all of you remember the story of Tanakan and patients starting to play flute after taking the full dose of Tanakan. And I know personally a case of a young female patient presenting to a neurologist who prescribed Tanakan based on clinical manifestations. But instead she said, well, wait a second, I'm quite young in terms of age and condition, and you are prescribing me a drug which is fit for terminal stage patients, and this is not anecdotal evidence. These are reported cases, also covered by some investigation efforts in Ukraine, and we are quite happy that we have succeeded quite productively in that respect. Also, we regulated well enough our own manufacturing brands. Let's assume we have an X as a commodity with a price tag 10 hryvnia in a local pharmacy. But if there would be a custom-made batch for a particular distribution network, so it would be labeled X/network name. And that same commodity, that same drug, either made in Europe or in Europe, would have the price tag multiplied by 20, 30 times more. And any pharmacy would be interested in selling that particular product because they earn extra benefits on that. And again, we're facing a lot of challenges, and we don't have to reinvent solutions because there are functional solutions available in the European space, in the United States. But also, it's important to recall another aspect of the reforms. The annexes to the current law on public health, yes, the time has come. As Dr. Igor has explained, we're prominent enough and sometimes ahead of our time with this law, including the anti-vax. I believe you remember what was happening with Madam Skabeyeva jumping out of the TV screen literally when describing how Ukraine is passing the new legislation. But again, remembering that this law is innovative, but yet now is the time to have it amended and improved to catch up with the pace of time, particularly in the context of the war. And dear Igor, we'll be looking forward to having your advice on that. Thank you so much, dear Mikhailo, for all of your insights, particularly for recalling the Kharkiv story. I believe it was the story of Dmytro Oleynik, who was advised the medical examination commission to go back into the battlefield to actually have his extremity amputated for the benefit of recognition as a person with disability. Well, again, this is not dictatorship in essence, but my next question would be, what are the norms and standards that you were personally involved over the course of these recent 5 years, where you faced major opposition, even resistance from the corruption point of view, or maybe some pressure? Well, major resistance, that was the law on public health. It was resistance in its essence. These were brutal fights with bloodshed, literally. But again, some of the people inflicting that have been recognized as traitors, but I believe you do remember those nude broadcasts, the anti-vaccine campaigns in front of the parliament building. And again, back then I didn't pay so much attention to it, but now, taking a second look at that, and again, I'm watching some of those interviews, facing the camera, thanking our dear friends from St. Petersburg for supporting this public campaign. Back then, this didn't catch my ear with that intensity as it does now. But that clearly explains what are the roots of such anti-immunization campaigns. The next one would be the law on quality and safety of pharma products. That was a major challenge. I do remember how many debates we had with WHO, with the European Commission. I set aside EBA and AmCham. Nevertheless, the law was passed. And most importantly, now at the time of war, thanks to that law, we don't have any problems with the blood in country. So thank you once again to all of those who contributed to our verbal battles, but that helped us to improve the law on blood safety. And again, time is changing, time is developing, and this law should be evolving further. Another example would be the drug on medicines and medical products, which, for the first time over the period of Ukrainian independence, introduced some rules of play in the Ukrainian pharma market, sometimes disabling some of those corruption-related or even corruption-infused processes and proceedings, preventing some of the misdeeds and products manufactured somewhere in United States, in Europe, in Japan, would be going through the 7 circles of hell with artificial obstacles imposed. Another example could be this law that was initiated by the National Security and Defense Council, and following the presidential decree, and this would be the law on amending the fundamental law on medicines. And again, State Expert Center doesn't love us dearly as the result of that amendment, but we can see that that was important, and now this law is fully functional. Following up on that, I believe that corruption is available not only in Ukraine, it's persistent all over the world, but the laws which fight corruption sometimes are very difficult to pass. Nobody wants to play that dirty game in a clean manner. And again, there are different types of corruption, and respectively, we need the anti-corruption of the same intensity, quality. But what I love dearly is the fight to corruption by the countries at the average level, by means of total declaration. United States, for example, everybody has to declare whether you're a homeless person living in the street or maybe you are the president sitting in the White House, but you have to submit your declaration. And once you have your declaration signed, you are transparent, you are open in front of the public and the law. And with translating that into some of the Ukrainian realities, I believe I should not be reciting some of the messages I have in my messages, but all of the clinicians of the Medical Examination Commission should have submitted their declarations, and they should have done that by now, indeed. So again, introducing the declaration method for those introduced in the military examination commissions, as well as disability certification commissions. They have to submit their declarations, but the amount of resistance and opposition to that is superb, even in comparison with the innovation. With that, over to you, Dr. Habib. Let me ask you a question, since you are a person who lives in Ukraine for so many years. So imagine you are a regular citizen. What would be your thoughts, ideas in your neighborhood? Do you see more pharmacies than groceries or not? And what are your thoughts about that?
Question. We are diverting a little bit from core public health, but let me start from on the pharmacies. I see a lot. I counted once that when I walk to my office, at least I pass around 5-6 pharmacies. When I go in the morning to gym, I pass 8 pharmacies, and I think we have many of them, but I think we need to look into that one in its complexity. Because we are meeting here in Kiev, and I see so many pharmacies. But when I go to the villages, or when I'm traveling in the front line in Kharkiv or Donetsk Oblast or in Kherson, I don't see those pharmacies. And there we need to find other ways to get the medicines. Actually, people who are living there and might not have pharmacy 35, 50 kilometers from their house. So I think we need to look, Ukraine is a big country. We need to look what are the incentives in the market, why we have the pharmacies always in the big cities, what is the number of the pharmacies we have, and then how we have incentives in place that we have pharmacies close to the home where we are. And I think that's extremely important, because then what we saw also after liberation of Bucha and Irpin or Makariv, what we see in the second wave of liberation in the autumn of 2022, it was very important to bring very quickly the pharma medicines back, the primary care back, but then also public health back. So I think that is a very, very important. But let me get us a little bit closer back what we are discussing, what is the public health. And as we are going through the war, my view is that we need even more public health after the war than we ever thought before. And why I'm saying that, Ihor brought up Kakhovka Dam explosion and the impact in nearby oblasts. But I think we don't know yet what is the full impact of the war to the environment, what is the full impact of the war to the air, to the noise, and so what is the impact to water and the water quality, the drinking water that we have been discussing as well. So I think when we look to the impact of the war to public health, that is actually huge. And in that sense, the capacities you are building in the regional CDCs, in Kiev, in Ukraine Public Health Center, and across the whole country, I think we need to think what is ahead of us in the coming years, because we need to look to two aspects. We need to look how we approximate to the EU regulation and practices, but then also we need to look how we restore the environment and everything else around us. And that needs intersectoriality from one hand, because we need to work with private sector, we need to work with businesses, we need to ensure that the water, air, food, everything is there. But it needs a public health community which is ensuring that these norms and standards are really put in practice. So I just wanted to bring that small element in, because living long in Ukraine, and we talked before that we have had disease outbreaks which have been there, we have closed them, we have had COVID, we have had war, and let's remind ourselves that this war started in 2014. If we go back in Donetsk and Luhansk Oblast, and there we have addressed the same matters for more than 10 years, then when there is a day after, actually for public health community, sorry to say to you, you have more work after than until now. And that is something very, very important that we realize, that the day after for public health community will be even more work. And that is something that is ahead of us, and we need to embrace it and find the ways how to deal with it.
Thank you very much. I would like to give to the attendees the opportunity to make some questions to the panel. There are some questions.
Друзі, запитання. У вас рідкісна...
Colleagues, this is a rare chance for you now to ask your question. If you have any, please raise your hand and ask a question. Better ask it with the microphone. If no questions, we may continue, because we have more questions to ask, of course.
One last question from my side. We talk a lot about the outbreak, we talk a lot about the public health, and we are a long war since 2014. So it's one of the epidemics that we heard, not only in Ukraine, but in this world context, is the mental health. So I would like to ask all of you, and maybe you can start with the WHO, how is facing this really problem worldwide, but also in this world context, especially in the regions, but also for the whole country. Thank you.
That's a good question, and I really, let's put that in the context. I really appreciate that Ukraine started to talk about mental health and war in the very early days of the full-scale invasion, if I think back March, April 2022. And that has allowed to scale up the programs of mental health, which are led by, First Lady Olena Zelenska and what Mihailo was also mentioning. And now we have new mental health law in place. And the key challenge what we have is, while Mihailo was mentioning 10 million, that was our first calculation. But I think the mental health and the impact of the war to the mental health will be long-lasting. It will be much bigger than the 10 million we have been talking. And why I'm saying that, in 2017, 1 out of 10 people in Ukraine said that their overall health is impacted by anxiety, stress. It was 1 out of 10. Now in 2023, from the latest health index survey, we see it is 6 out of 10. So it is already 6-fold compared to the pre-war. So my feeling is that while we need to do the studies, while we need to invest to the mental health, the impact will be large, long-lasting, and according to my estimates, at least end of this century. Because what the children are going through, what the next generations are going through, that will be long-lasting. So the mental health impact will be long. And in that setting, having mental health regulation in place, scaling up the services, that is important. And I think what we need to look is how people have their own tools available, like the Self-Help Plus, like the other tools to manage stress and mental health, but then also what services are available. And there, what is ahead of us, particularly, is to scale up mental health services even further when there is a one day when the war might be over. Because then the key question is also how those who have protected Ukraine, when they return back, and that's why we need to look to the veterans, that's why we need to look to barrier-free environment, how they can return home and how they have services available. So that's why I think mental health is very, very complex, but it's not only mental health. It's the same for mental health. It's the same for rehabilitation. In Ukraine, we have 100,000 more amputation that we need, how they can come back and to be integrated. Further, we have non-communicable diseases. We have not discussed about that too much today. And I'm just broadening a little bit what is ahead of us. 35% of people in Ukraine have delayed their care as of today. That means that they will develop chronic diseases that otherwise they could go to the primary care doctor or to hospital or to the outpatient setting. So we will estimate, we see that there is much higher role for NCDs. And even before war, we know that between 85 and 90% of mortality is related to NCDs. But that will be even larger role. And that means that we lose a lot of human capital. And I think that's a critical matter for us, because then the key question is how we ensure that Ukraine can grow and the health of people is there. So I think it's mental health, as you asked, but I think for public health community, it's much, much, much wider. So, and that's a kind of challenge because we need to work on EU approximation. We need to build up institutions which have young staff, new people. I have never seen enough people in public health. And I think that's an important thing, that how we train the public health colleagues and to have them available. And that's why with the ministry, we are working on public health workforce strategy and how then basically we ensure that the services are available. And I assume you don't give the microphone back to me. So I wanted to say 3 things more what is in our agenda. I think health security is in our agenda. But there, I think there are 2 things. One is how we can support Ukraine to have national action plan on health security, how to put that in place. But I think also there is a great opportunity because what Ihor was mentioning, how Ukraine has been adapting and learning. I think we need to do as a global community and European community, we need to come and learn from Ukraine. It's not so much, as a WHO, we are doing more study visits to Ukraine rather than getting people out of Ukraine, because there is so much learning to do, how you have been actually working throughout the war, and we need to look to that. So, but the health security is something that we need to address, but the learning needs to go on both ways, not only in one way. The other part I mentioned a little bit, what is ahead of us is environment and understand the impact of the war. It's a challenge, but we need to find out, and all of your brains and ideas are most welcome, how we can monitor that impact. And the third topic that has not been discussed so much, but I want to put here on the table for us to think, because it's core of public health, is statistics and data. How we know where the diseases are. Do we have surveillance systems in place? How we know that the modern statistics is there, and how we know that it is quickly there? Because I think that is very, very important to measure the impact of war, but also in the future to ensure that we know what is happening in public health. And Ukraine is to also ensure that the statistics is reported not only to WHO, but equally to the OECD, to Eurostat and others. And that is something that we sometimes lack, is how to ensure that we have modern and good health statistics in place, because that allows us actually to make the case for public health. And if we don't have that data, it's very difficult to talk about public health, because here, I think all of us in the room are public health experts in one way or another. But without that data, we cannot talk to the ministries of economy, ministries of finance, or everybody else. And Radutsky has challenged to convince all the other committees, because he needs to ensure that the tobacco taxes are increased, or we look how the alcohol policies are made. All the data is very, very important for intersectorial work. So I started from mental health, but I'm trying to say that for us as a public health community, interesting times are ahead. I can promise you more work, more challenges, and but that keeps us also young, because then we have a lot of things to do. Thank you.
Дякуємо. Це запитання було, друзі, до всіх останнє.
Colleagues, that was the last question, but it was a question to everyone, right? Was it addressed to everyone? Yes. Ihor, that was a question to you as well, by the way. Well, it's not easy to add anything after Jarno, because he's making really comprehensive answers. Not easy to give answer after Jarno said his word. But let me put it this way. The war and conflicts, they usually lead to vulnerability of population in terms of stress, disorders, and they definitely lead to a higher relevancy of mental health. That has been proved by all countries, involved into conflict situations or wars. And let me reiterate, probably, for the public health system in Ukraine, the biggest part of work will come after the war is over. And why is it so? Based on the most recent data, Jarno was mentioning some other figures, in fact, but the survey of the recent year, not this year, but the recent year, by the World Bank demonstrated that 14 patients delayed their visit to the family physician because of security reasons. Meaning, these are the people that decided to stay at the level of their household, not seeking for care. They did not get timely care, and unfortunately, because of that, their chronic conditions during this time of non-seeking for care might grow, might develop, and the condition might deteriorate. Therefore, the issue of mental health is a critical, a pivotal issue for Ukraine. And definitely, we will observe figures much higher than the European region countries. In order to minimize it or prevent it somehow, the key point I see could be effective and very rapid actions taken by the primary care physicians implementation of mental health programs at schools, because we know that school children, they usually, you know, talk to each other, and it is not always that they apply or present themselves to a family physician in case of any problems. So if we have a comprehensive, universal program like that, and I have to say we have something like that available in Ukraine that was initiated again by the First Lady of Ukraine, Olena Zelenska, we can reach the effect that we expect. That is minimization of war-related impact on mental health. But the answer to your question is definitely yes. That is a problem also in the European countries. The reason behind it is different. I have to say that COVID pandemics has significantly focused our attention on mental health. People spend a lot of time inside. They couldn't leave their houses. Many issues associated with lack of care, lack of communication. People didn't have a chance to speak to their relatives, to their friends, make new friends, and stuff like that. And we observe these mental-related problems in all countries. In Ukraine, that situation is even more aggravated because we have combined risks and challenges. So probably these massive, large-scale program is the only way to minimize this effect. Thank you very much, Ihor. Just to close this topic of mental health, Mikhailo, I would like to listen to your opinion. Jarno mentioned some statistics. How important the figures and the statistics for you as a MP? How this could be used to do some, you know, calculations or estimations for mental health? Because it's more or less evident with the common diseases, but how do we behave with the mental health? Is there a problem with mental health in Ukraine? And where do we get these figures from? Well, unfortunately, I have to say we don't have a professional statistics, so to say, in the field of mental health. We're still using the reports from the family physicians, which are submitted into the e-health system. And this is what we see at the moment. Some separate, dedicated statistics is something that still needs to be developed. It's not going to be easy, especially in the beginning, because, come on, we're Ukrainians. You don't just show up to a doctor and say like, hey, I feel like I'm having some psychological problems. No, that's not the Ukrainian way. No, that's not what we do. Probably you don't see many people like that. And come on, that's Ukrainian nature. That's the way we behave. So probably what I'm driving at is that statistics might not be very reliable. But when the law is fully, you know, in place, I expect that we're gonna have specialists who will be able to start providing care and assistance according to the well-defined methodology and technique that will cause trust, and people will come to get this assistance. So it will be kind of not making you, but kind of encouraging you to do that. And then the employers at some point will, you know, seek for a professional in the field of mental health. So some care could be provided to the employees and stuff like that. And let me speak about one more thing. Jarno mentioned about that I have to talk to my colleagues from different other committees and ministries to persuade them what to do. At some point in time, we're going to have quite a number of PTSD patients, people with PTSD. I don't want to overestimate the role of COVID. It made its impact, it's true. We keep talking about COVID and COVID, people keep, recollecting COVID, but come on, there was COVID, you just take a pill of Fluxamide and that's it, you just continue. But it doesn't help you with your mental health problems. And here we face two main challenges. We talked about that with USAID, well, during their good times, of course. And we have a very nice thing called per capita or capitation rate. I think at the time when it was introduced, that was the only way to actually change, to start changes in the field of healthcare system in Ukraine, to launch this NHS of Ukraine and stuff like that. But at the moment, I guess, these per capita rates, they need to be, they kind of need to be revised. So this approach may be revised. We might think about adding some KPI rates to per capita rates. Because, come on, let's be frank, the family physicians are quite overloaded at the moment with a lot of job. And if we do not monitor the performance of a doctor, let's say how many chronic patients exacerbated, how many out of the total number of his or her patients with hypertonic hypertension had a stroke. That is a very sad statistics, but that could provide you with some, better insights about the performance, and you could use this performance, this KPI indicators. Where do you get the money from? When you have a talk about that with the finances minister, he says like, okay, tell me, do you want me to get you money that I plan to spend on patriots or on electronic warfare? Come on, make your choice. We realize the situation well, and everybody does. But we talked about some advocacy. The parliament is not very much in a hurry, I have to admit, in signing the law on tax on beverages. The law is available. It is not signed yet. That could bring you some additional 7, I guess, billion Ukrainian hryvnia. If we count insulin cost, if we do calculations of the cost of diabetes treatment, well, you might save on that just a bit. That could be used for some good purposes. We have prohibited the use of trans fats. And if you violate this 2% margin, if the company violates that, well, you could, why not fine them? And you could use this money for some good purposes again. So we have problems with finances, that is true. But we also have problems with statistics. Statistics will always be low in Ukraine when you talk about mental health, because very many people will never go to a psychologist. They will only show up to a psychiatrist. And even then, statistics will not be very, very reliable. So, despite all of that, some statistics could be, used. We can operate on that. And Jarno mentioned up to 10 million of people, and I think that figure could be unfortunate, but more or less true. And, Marichka, I think we need to apply to some people from TV. I think we might give some part of broadcasting time to some certified psychiatrists and psychologists so that 2 or 3 minutes could be provided to them in the morning, during the breakfast time, so that they would just tell people, communicate to people how self-care is important, what one should do, what one may do, and media, I think, could be very helpful in this case. Thank you very much, colleagues. Thank you very much, Jesus Perez Formico, for this co-moderation. Let's hear it to all of us. And if you don't have any more questions from the audience, we're ready to let our speakers go. Let's make a quick photo now, and then we're done. Dear friends, thank you very much. Please resume your seats. And I guess we're quite ready to continue. Our next panel is dedicated to the blood safety in Ukraine, the joint work of project, and our partners. And I invite Mohamed Farouk, the key expert for blood safety, Dmytro Koval, Director General, Ukrainian Center for Transplant Coordination, and also Alexander Serhiyenko, Deputy Director General, Ukrainian Center for Transplant Coordination. Colleagues, please take your seats. And we're going to be talking about a very important topic, one of the laws just recently approved within the given ongoing reform, and the value of that law has already been mentioned and talked about by the members of the previous panel.
The importance of donors, of blood donations, and how it has improved in Ukraine over the past 6 years.
Okay, thank you very much. Of course, it goes without saying that blood donors are the main thing in the blood transfusion, because there is no source of blood except human donation. Until now, there is no synthetic blood. There is nothing that can take the function of blood except human donation. So donors are the cornerstone of any blood transfusion system. Typically, according to like international figures, the percentage of donation is like 1 to 2% of the total population. So if we have like a country with 100 million population, then the number of blood donors or the number of donations per year should be like 1 million to 2 million blood donations per year. When we started here in Ukraine, the number was, let's say, much less than this. And this was not the main thing, but the main thing was that the main pool of the donors, it was coming from family replacement and sometimes paid donation. And using family replacement and paid donation can be risky a little bit, not a little bit, actually can be too much risky, because when we put someone under pressure to donate blood, they may not fulfill the real requirements for blood transfusion, but still they come to donate blood just to get the money or to save one of their beloved ones to be admitted to the hospital. And this increases the risk of blood transfusion and may result in missing some infections that will be transmitted to patients in the future. Because even with testing, even when we test blood using the most advanced technology, still there is a residual risk in blood. Blood will be always a source of infection, and we cannot eliminate this risk of transmitting diseases through blood transfusion. So that's why relying on voluntary donors was the main thing that we were working with in order to improve the blood safety in Ukraine. And we tried to tackle it from two different dimensions. First, through the new law of blood safety in Ukraine. The law recommended voluntary non-remunerated blood donation as the main source for blood donation. And it gave like a transitional period. So it didn't say like tomorrow all donors should be voluntary non-remunerated. No, it gave like a transitional period for blood transfusion system to shift from family replacement and paid donation to voluntary non-remunerated donation. I guess this transitional period was like 5 years, if I remember correctly. And the other way we tackled this voluntary non-remunerated donation issue was to start to create some like cultural changes in the community and do like communication campaigns, promoting voluntary donation, collaborating with different NGOs in the field of blood transfusion to adopt the concept of voluntary blood donation and promote it among their donor population. So just to cut it short, voluntary non-remunerated donors are the most safe and reliable blood donors. And it was obvious during COVID-19, paid donors and family replacement donors, they did not show up, but the ones who donated blood during COVID-19 and during the war, they were mainly the voluntary donors who are just donating blood because it's something good by virtue. nothing. They are not waiting anything in return, even to get their test results for HIV, HBV, and HCV. They are not even waiting to get the results. They just do it as a kind of a human action. Thank you.
Before I pass on the word to Dmitro, could you remind the number that you mentioned in the very beginning of your speech? What is the safe percentage or required percentage of blood donors for the population for health safety?
It's from 1 to 2% of the total population. This is the optimum number of blood donations per year. However, we should not take it as an absolute number because it depends also on many other issues. It depends on how mature is the healthcare system. So if we have very mature healthcare system with a lot of tertiary interventions, they need blood for transplant operations, they need more blood for medical care. So the amount of blood needed will be more. But if we have less mature healthcare system that's only mainly working on the primary healthcare, the need for blood will be less. Also, it depends on the number of acute beds in hospital. The more acute beds we have, the more need for blood we will need. It depends also on the general safety. Let's say in some countries where there is a high prevalence of road accidents, natural disasters, and so on, again, these factors increase or decrease the need for blood. But let's say 1 to 2% of the total population is the optimum number. Thank you.
Дуже дякую. Пане Дмитре,
Thank you so much, dear Dmitro. There was a reason why I invited Mohammed to quote those numbers and ranges. But speaking of Ukraine as a country and as a system, what is percentage in Ukraine when it comes to donorship? Well, let me invite you to set aside the 30 years of Ukrainian independence for the measurement of time scale, because we are now operating at the time of war, which is fundamentally changing all the scales, ratios, and percentages. Remembering how many internally displaced people we have, remembering the number of Ukrainians who moved outside of the country. And frequently enough, these were young and healthy people who would be expected to become donors, and now they live elsewhere but not in Ukraine. Also, speaking of the war, the direct result would be smaller number of local population, but at the same time smaller number of donors available in that country. And thus, when setting those numbers, we have to understand that activities implemented by the blood centers, including those related to the blood donors, have to be purposefully aimed at the following goals: making sure that the number of regular donors should be increasing, which is critically important. And I do understand why you, Mohammed, are starting with this important number, and particularly emphasizing importance of promoting voluntary donors, because this is a critically important life-saving matter. But answering your question, dear Marichka, let me start from another side of this phenomenon. The matter is that it's a multifaceted phenomenon indeed, but also we have to discuss such important things like laws, executive orders, but at the same time, I would like to remind us that we have blood center managers here, and I would like to invite you to stand, because these are the people without whose performance Ukrainian blood system would not be so resilient, regardless of legislation available. And also, let me invite all of those who joined your managers so that we can see how big is the team of blood centers. This would be the right thing to do. Yes, we thank you so much. We do appreciate your commitment, both personal and professional. And having seated now, let me follow up to explain that we do understand how big is the amount of work to be done in the future. And also, Coming back to expressions of appreciation, we would like to thank the European Commission, European Union, the GFA project, and particularly you, Mohammed, as well as the rest of your team that we are working with. Because despite this full-scale invasion, despite the fact that the best expectation would be 2, maybe 3 weeks of Ukraine to survive as a nation after the start of that full-scale aggression. But up until today, we have not received a single drop of blood from outside of Ukraine. This is a huge result and achievement, while at the same time we can, relying on the technical support and assistance, continue implementing those transformations and reforms which approximate Ukrainian blood system to European blood systems, and we truly appreciate that. Thank you so much. And now over to you, Alexander, but feel free to contribute, Dmitry, further. Following up on this thesis that the number of voluntary donors is also important for the safety, because all of those who sell their blood for money, then definitely they might have health issues, they might not fully comply with the standards and practices of donorship. But how can we sustain the safety and quality of blood which is donated? Well, speaking of the system, how it works here, well, again, I also would like to join the pool of expressions and appreciation in favor of the professionals sitting here, but also representatives of the non-government organizations who offered their helping hand both during the peaceful time and during the wartime, because thanks to your support we survived. Further on, everything we do, all of the processes that we have introduced and established in the blood safety, they secure the safety and quality. And remembering that voluntary donation is the basis for that. Today, in the morning, I also joined this donating campaign. And what I've seen is that, first of all of the donations were not remunerated. Moreover, the donors were rejecting those 76 hryvnias, which is dispensed by the state for every donor. I was one of them. And that's a good sign, because I do strongly believe, looking at what is happening today in country, whenever there is a call for donations, whenever there is any emergency happening, and looking at those lines of people queuing up at the doorstep of the blood centers, this really demonstrates that we are moving in the right direction. I will not be quoting any numbers, because that is not just sensitive information, this is secret information at the time of war. But we are doing well enough, not ideally, because they still have transformation to deliver, but we are on the right track. Speaking of the system, how well is system managing such emergency cases when you need blood here, now, in huge quantities? I never heard such appeal in Kryvyi Rih a couple of days ago. Does that mean that blood was provided to all of the survivors who needed that? Maybe there is another reason explaining why no appeal was publicized. Well, first of all, this is thanks to the respective planning and management done in different locations. Because stockpiling is important, planning your needs is important. And every blood center is stockpiling some blood and blood products on the one hand. Secondly, we have a system designed to function well during the wartime. And it really is fully functional to meet all the needs in blood and blood products, not only in civilian sector, but also in the military sector. I also have to acknowledge that our system is currently scrutinized by European Union experts. We also provided some advice and consultancy support to Estonia, to Lithuania, and also other partners who is asking for our advice, and we are happy to share our experience. Moreover, this year, the NATO is revising their standards, and they are doing this in intensified mode, namely relying on Ukrainian experience, because they understand that they have to change some of the fundamentals of their approach, both in the military and civilian sector application. To the best of my knowledge, the Republic of Romania has borrowed our regulations describing the system functioning, and they use it as the basis for their new law, which is now in drafting and will be endorsed soon enough. In other words, all these are functional elements of the system that we have established, which is actively implemented by the system of blood centers. Of course, there are some random cases occurring, like after the missile strike on the Ohmedit, when one professor, he started sharing this among his subscribers. Well, I personally was there in Ohmedit immediately after that happened, when everybody was invited to donate blood. But the fact is that the respective stock of blood was available. And the question is, why did you ask that question? Why did you ask people to donate blood? Because there is some life expectancy with the blood products. You cannot stockpile them forever. Okay, I understand that operating with any numbers and statistics during the time of war is highly sensitive and secret issue. But what is the generation of donors that we can see now in Ukraine? Are these young people, middle age? Who would be how would you describe the profile? Who are the leaders in blood donations? As a matter of fact, based on our observations, it depends and differs from region to region. As a matter of rule, these would be young people. Speaking of the regular donors' age, they are growing younger, which is a good thing, because that means we are developing the culture of blood donation in the country. And by all means, working with population, and again, maybe these are dry phrases I'm using, I mean, work with population, but it should be starting at schools, namely at student bench, where you have to describe, explain, and educate a child, an adolescent, a young person, why it is important to donate blood and save lives. There is another important element which you, dear colleagues, do see in all of the videos that you can see publicized, including those videos which where you, Marichko, is the messenger and the advocate. And that would be the female face of donors, because now we are paying more and more attention, namely on female donors, because males, many of them, most of them, are in the battlefield. And that means that namely feminine shoulders are bearing this burden of donorship.
And I have a question to you, people present here. Who of you ever donated blood? Have you ever donated?
Піднімайте, raise your hand.
It's impressive.
Don't forget to raise your hand.
At the beginning of the project, and also we had a lot of audience. I asked the same question: how many blood donors we have here? I can tell you it was very disappointing. We had like 10 hands only raised. So now having this number, I think it's a good sign that the country is progressing.
Але разом з тим, нас тут багато так працівників центрів крові.
Well, we have quite a number of people from the blood donation centers. So you look like hostages. You know, in order to have the higher rates of donation, it feels like does it actually exist? That the blood donation people, staff, do you have it on your contract? You have to donate often? No, you can't make it very often. You do it only according to the regulations. Is it once in a 4 month, or is it more often? As a coordinator at the national level, we actually do not have access to all of this information at the moment. This is because the electronic information system is not fully deployed yet. But if we continue this discussion about donors and their profile, probably we need to get this discussion back to regular donations. Regular donations among general population. Because if we speak about this audience, you don't see random people here. Yeah, but random people might be listening to your presentation, to your speech. So you can very quickly remind them of a very simple mechanism. Where do you find the blood donation center? How to plan? How to schedule your visit? Because, you know, Ukrainians love it. They like it simple and organized. Well, as a national coordinator, I'm trying to keep myself in hands to avoid talking about management issues. And we will be able to discuss it in more detail with my colleagues from the blood donation centers, because they are staying here for tomorrow as well, due to our project activities. But you're quite correct. We can always encourage everyone to donate blood, because even one donation may save several lives. You should keep it in mind. Okay, let me be very clear. I want to donate. Where do I find a place to donate? What website do I need to go? We have a website called Donor Platform. There is a so-called donor traffic light, which is formed automatically based on the data provided by the donation blood centers using corresponding information systems. And regardless of the region where you reside, you can always double check if there is a demand, if there is a need for your type or your rhesus blood. If you do not know what blood type and rhesus you have, you can still attend or give a call. There are some contact telephones available, and then you go to the blood donation center, and after the visit you will perfectly know what is your blood type and your rhesus factor. So you can go on Google Donor Ukrainian Center for Transplant Coordination, or you can just type donate blood in different combinations. You will probably end up on this website, and then based on the region you reside, you will see this donor traffic light. And a very good bonus, don't forget to mention, your blood will be tested for the most common diseases and pathogens. That sounds like a very good addendum, like a very good compliment. Colleagues, maybe you have questions, because this is a very good topic you would like to speak about, I guess.
Okay, so I just wanted to communicate and explain to the audience here what we did in this project in the area of blood transfusion and what is still waiting. Because I don't want the impression that blood transfusion is perfect, everything is okay, we need nothing. No, actually it's the blood transfusion area is always evolving. What we did here, our work was mainly on the central level, okay? So a new law of blood safety was developed, largely aligned with the EU requirements. The system is restructured at the central level. So we have the central coordinator, the National Blood Transfusion Center, and we have the competent authority, independent competent authority under the State Drug Authority. And we have the National Blood Transfusion Committee. So these are all changes at the central level. And a lot of implementing regulations were also developed and they are under implementation and so on. However, what is next is to move to the regional level, okay? To work on implementing all these stuff, improving the capacities of each single person working in the field in the different regions of the country, okay? So this is the next step to do now. I can describe the system here now is as centrally coordinated and regionally operated system, which works perfectly in the current situation of the war, when you will not be able to transport blood very quickly between regions, when you have a disaster in some region in one moment and no time to bring from Kyiv or something. So this regional operation is perfect for this time. What we need to do also, we said the first thing, by the way, regarding the law and the restructuring and everything, if I ask in this room, how many of you is satisfied with this? And I receive the answer, all of us are satisfied, I would be worried, because this means that we did nothing. Because change means that you will have resistance and you will have support. So hopefully not everyone is satisfied with the changes, because this means that we still have the process. Second, what we need to do also, the EU approved recently, a few months ago, the new EU regulation on substance of human origin. So we will need to revisit the law that we have now in Ukraine and to make sure it is aligned with this new EU regulation. This EU regulation will be mandatory in Europe starting 2027. So we still have time here to review the law, make sure that everything is okay. The third step that we need to do is to move also to the more comprehensive approach of substance of human origin rather than blood. Now that the approach at the EU level and in many other countries is to put all these substance of human origin under one umbrella, under one coordinator, under one regulator. So also I think in the upcoming few years, Ukraine need to adopt this approach. Also, as highlighted by Alexander, Ukraine need to export its experience to other EU countries, okay? It's a very rich experience. The blood system kept working in COVID, in war, under all circumstances. And this experience is very valuable, and Ukraine needs to exchange it with the other EU partners. Last thing, that the focus also, I believe, I recommend to focus more on the patient side of the blood transfusion chain, how we use the blood. It's not enough that we deal with the supply, and then the demand or the use of blood is not having the same attention. So also we need to focus on the use side of the blood, namely patient blood management or appropriate clinical use of blood, to invest more and to train clinicians more. Thank you. Sorry for being long. Just wanted to make sure that we all have this simple understanding of the blood transfusion system here. Thank you.
Дякуємо. Друзі, запитання. Наважились ви з запитаннями?
Mohammed back our discussion for serious issues. Thank you very much. Mohammed, I have a small question. I hope so. For your opinion, how our blood system, Ukrainian blood system, have a readiness for European rules and similarity for I asking about your opinion about readiness of Ukrainian blood system for European rules. What are you thinking about?
Okay, maybe I am not in the best position to say this, because I am part of this project. I'm working closely with you, so it may be a conflict of interest if I say Ukraine is 100% aligned or not aligned. But I can say that there are no major issues in terms of alignment with the EU. However, as we said, it's a continuous process. Okay, we cannot say, okay, now we have the law, we relax and nothing more. The implementation is really as equal as important as the development of the legal base and the structure. Yeah, we have the legal base, we have the structure, we have the implementing regulations, but the implementation of all these nice things that we have at the regional level is as equal as the development process. This is what I can say.
You mean marking for traceability, global standards, SBT 128,
Quality
etc.
management system, GMP, ISPT 128, all these elements to be implemented at the regional level.
Дякую, друзі. Попереду в нас дві важливі речі. Це
Well, thank you very much, colleagues. We have two more important things to happen today. This is blood donation and lunch. You have another question? Of course, of course. That is not a question. I'm going to be very brief. Marichka is here not by chance. This is because she's here because we cooperate with Marichka for a long period of time. And I can see Yaroslav showing up as well. So, colleagues, if you go on a donorship donor platform, you can see a whole section dedicated to ambassadors of blood donation in Ukraine. And to my mind, to our mind, Marichka is an ambassador for blood donation in Ukraine. This is because despite and regardless of the situation, she keeps talking about the importance of blood donation, and she also donates blood. She says, yes, I do donate. So let me thank you very much for that. That needs to be somehow, marked. Yaroslav, could you please approach me as well? As a staff from the Ministry of Justice, who was involved into organization of all these processes, and it all started from Ohmaddit, you remember. But regardless of your positions, regardless of your career development, he keeps talking about blood donation, and he keeps donating blood as well. So thank you very much for that. Now I'm done. Okay, colleagues, lunch and donation. What do we do first? Do we get our lunch and then we donate, or we donate and then we eat? No, we first donate. There are some refreshments available. So, colleagues, those of you who plan to donate, please go donate. The others who do not donate, go take your refreshments. Don't forget about your colleagues, so that they would get something as well, and then we come back. Colleagues, thank you very much to everyone for coming back on time, and we are thankful for 35 donors who donated blood. Thank you very much for a very tasty lunch, dear organizers. We have another panel, we have another discussion dedicated to the next project plans, what comes next. And I would like to invite now Marina Slobodnichenko, the Deputy Minister of Health of Ukraine for European integration. I would also like to invite Olga Gvozdetska, the Deputy Director General of the Public Health Center of Ukraine, and Olga Polotska, Executive Director of the National Research Foundation of Ukraine, hosting Horizon Europe office in Ukraine. Olga, please join us. Marina, we will probably start with you, if you do not mind. Well, everyone, hello, first of all. Well, thank you very much for talking about future steps. It is very nice that today we have a chance to speak about achievements and developments, but this is also a great honor for me to share some next step plans, the future steps. You know, we keep sleeping during the air raid alerts. We wake up during night time after the air raid alerts. And we are really going through some really complicated period of time. And we do that for the sake of building the new country, to save the country, to save the economics, to save the people. And in our field, in our environment, it is most important really to come up with the new sustainable healthcare system that could really serve and be used as a model for action for the whole European region. I might seem to dive you into some bureaucratic process at the moment, but I still think it is very important to talk about that, because it is about people working with you, hand to hand, shoulder to shoulder, your colleagues, your staff, your students. So, as of today, speaking of the Euro integration process, I would say we're now at the stage of screening, which is about a very detailed analysis of national legislation with regards to its compliance to the European infrastructure. We have 35 sections, and the healthcare field is present in 23 out of those. So basically, at every section, at every step of discussions about the Euro integration, healthcare is always there. Therefore, the delegation from Ukraine, with a total number of more than 20 persons, they have recently attended the European Commission premises, and they have had the chance to speak about the achievements of Ukraine in the field of healthcare. It is not done yet. We're not stopping, we're not breaking this process. We have some future steps and meetings. Very soon we are launching some negotiations dedicated to the customs issues. In April, we're going to have a screening in June dedicated to environment, climate, and civil protection. We will also speak about water surfaces, and of course, healthcare topic is going to be also talked about, which is very important for many of us present here. And in September, one of the most complicated and challenging sections to be talked about will be dedicated to food safety, veterinary, and phytosanitary policies. Probably that is going to be one of the most challenging components, as I mentioned, because these issues are really critically important for EU, and we need to demonstrate on behalf of Ukraine a very good, very high level of readiness. So what is now in the focus of our attention? Number one, this is harmonization of the regulatory framework. Number two, digitalization. All the processes that take place in the field of legislation need to be digitalized and need to be combined with the European databases. But most important, I guess, is item number 3, which is about improving the institutional capacity. Regardless of how many talks, how many discussions you conduct with your colleagues and with your partners and stakeholders, it is always the topic of institutional capacity, the professionalism that pops up. Probably this is something that makes it possible for Ukraine really to go on, to go forward, to keep Ukrainian experience, and to go on with our development. I don't know if we have people from education field present here, but probably education is one of the most important pillars that need to be, worked upon. Using this QR code on the slide, you can go to a kind of a tab on a web page of the Ministry of Health that holds information about different training topics, which are absolutely free of charge. And you can go to that tab on the website and learn about that. And we're gonna be adding some new cases, some new trainings, making sure that people can get new knowledge and better understand the situation with the European standards. Another important point in order to strengthen our institutional capacity is the bilateral cooperation. On the given slide, you can see what are the European countries which we have very strong cooperation with, and I'm definitely very grateful to all of them. Now, you definitely know that the European Council is now headed by Poland, and Poland is very supportive to Ukraine. And we are present at different Polish organized platforms. We cooperate a lot with Poland, Denmark, and some other colleagues in the field of pharmaceutical development. And quite a number of partners help us in developing our future partnerships. Just recently, a couple of months ago, we had a great meeting dedicated to medical partnership in Lviv, and that is a project that really causes a lot of positive feedback from multiple stakeholders. It leads to a situation when, Ukrainian colleagues get additional experience and they kind of get a bit of, I would say, relax maybe, and learn about a different perspective. Because when you go to a foreign country and you have the feeling of how it looks like to perform a surgical intervention under peaceful conditions, how to get your training, that really works well. On the other hand, Ukraine is a very good example for foreign colleagues. This is also true for educational field. I guess Ukraine is now the only country which has not only theoretical experience, but also a lot of practical experience in this response activities. And we keep receiving multiple requests from our colleagues on sharing this experience. And I think this is something that we need to really work upon. And there is a huge request for that, for example, on behalf of the Baltic states. Let me also focus your attention on cooperation with the following European institutions, which makes us really inspired and encouraged. This is a Euro for Health project. Olga Gvozdetska will speak a lot about that just a bit later. This is the one which is about, the future opportunities. The Minister of Health is also involved into the HERA board work. This is the board which is very much focusing its attention on response activities, defining how the EU basically performs its response activities. We have also been involved into the cooperation with Critical Medicine Alliance. There is no dedicated law to that at the moment, but there is a draft developed at the level of European Commission, and it is expected to be approved, I hope soon. We have also joined the European Reference Network. It is about a rare diseases network that allows our Ukrainian physicians to cooperate very actively with healthcare facilities all over Europe. There are also several projects from TAIEX on medical devices, cosmetics, biocides. I guess this topic of biocides under TAIEX could be launched just in a couple of months. We also have two twinning projects, rather powerful ones, which we expect to be launched by the European Commission very soon. That is going to be dedicated to the regulatory control and also the trans-border threats. Let me update you, colleagues. The twinning project is usually when a foreign partner country helps us to implement not only regulatory framework or some regulatory documents, but also help us launch some processes. And let me also tell you that we cooperate very actively with the EMA agency. That is very relevant topic for Ukraine because the pharmaceutical market in Ukraine is considered to be a rather prospective one, especially as we're talking about some deficit of some drugs like antibiotics, for example. So what we're striving for, we want to make sure that our healthcare system remains sustainable. We want to make sure that we have high quality services and accessible drugs to patients. And most importantly, we are striving for the highly qualified medical staff. I mean, not only public health, but also in the field of healthcare system. This is because the staffing and the human resources policy is something that really helps you cope with multiple challenges. So a sustainable human resources strategy is a need. And we will talk about that as well. We will talk how we can strengthen our human capital, what opportunities may be provided to you, to our colleagues, for the sake of your additional experience and your additional training. And all of that is necessary to make sure that Ukraine becomes strong, sustainable, and our movement to Europe becomes inevitable, becomes unstoppable. Well, you know, let me mention one more thing. We keep talking about human resources, human capital, what people do, and you guys are all here just because you are making a very peculiar investment into the development of Ukraine. I am very much grateful to the GFA colleagues who made it possible for all of us to invest into the development of sustainable public health system in Ukraine, as well as our Euro integration movement. During this Euro integration activity, we have developed a kind of a book. You will see it now on the screen. You will see it soon on the website of the Ministry of Health. And the book tells about Ukrainian progress, but it talks mostly about people that made this progress possible. And this is because the human capital policy that is the enabler of all of that. I don't want to go deep into that. I will show you just a couple of slides and a couple of pages. But this is the story that tells you about the most important thing in this country. The people who make it possible. Probably I will give the floor to Olga Gvozdetska, who will now continue talking about people, human capital, and your capacities. Thank you very much, Marina. Well, Marina keeps calling me Marina, and I keep telling her Olga. This is why people are laughing at this joke. So I would like to ask for my presentation. And before I start it, I would like to thank everyone for partnership and friendship. That is extremely important if you are, getting down to some changes implementation. Let me speak briefly about EU for Health, which you talked about. I will briefly update you about the program in general. So the EU for Health program was approved in March 2021 by the European Commission as a program that has to respond to challenges to promote health, improve access to drugs, and in general we're supposed to improve the healthcare system capacity. It covers the period from 2021 through 2027, and here you can see the budget to make sure that health issue could be improved in EU. There are two implementing agencies. This is HADEA, HADEA, and HERA, which is supposed to respond to those threats. These are the two main implementing partners. As I told you, the duration of the program is 2021 through 2027. The total budget is 5.3 billion euro, but annual budget needs to be approved by the European Commission, and they make a decision about the allocation of these funds. Colleagues, we seem to be having an air raid alert. Can we continue? Okay, that was not in Kiev, somebody says. Probably that's for Kiev region. Okay, until we have it in Kiev, we can still continue. Let's continue. So there is a need to approve the budget annually, and they also define the work package of this program. At the same time, if you want to participate in the given program, you need to pay for participation. If Ukraine was supposed to pay for that, then, because we joined in 2022, so from that period of 2022 through 2027, we would have to pay 12.1 million euro just to be able to be part of that. Due to advocacy efforts from our minister, Viktor Lashko, in July 2022, an agreement was signed that Ukraine joins the given program, and in January 2023, the Ukrainian parliament ratified the agreement, and that allowed us to join the program on a free of charge basis, but still to be the fully fledged member of this program. That is a very big support, and that is a huge opportunity for us. So how is the program being implemented? As I told you, it needs to be approved on an annual basis, and there are two main pillars for implementation: either direct grants or joint action grants or open competition. So what does that mean? So when the grant is approved, well, the decision is made about grant, then they usually launch a whole program for grant nomination, and they ask for these nominations from corresponding partners like ministries. So then the agency is nominated for the given grant. The duration of these of preparing such a submission, for the grant, vary from 2 to 5 months. It depends on the topic, on the duration of the project, amount of activities. Norway, Spain, for example, they're quite active, as well as Portugal They nominate 2, 3, 5, 7 institutions from the whole region, and then each would be responsible for a small part on behalf of the country within the given project. So the duration may vary from 2 to 5 years. There may be 2, 3, or 4 or 5 years, and annually they need to be, approved and extended. There are several key components to the eHealth program. There is a programmatic committee that is the one that makes a decision about the next year operation. That is composed of 2 deputies, Igor Kuzin, Marina Slobodnichenko. We have our members in the program committee. We also have colleagues from the Ministry of Foreign Affairs, and we also have coordinators on our UPHC. This is me and my colleague. At the moment, we have 10 institutions which are the fully fledged members for grant program implementation since 2023. And you can see all of them right now on the monitor. I don't go deep into that, but let me just tell you, that is not only about funding, but this is also about expertise. This is about knowledge. That is about, sharing your knowledge. That is about networking and engaging additional expertise wherever you need it. Just to give you an example, the working program for 2024, the total budget was 752.4 million euro. During the year, the European Commission revised the budget, and they took almost 20% of the total budget and redirected that to direct support to Ukraine. So additionally to what we already got, we received additional 20%. There was no, competition for that, but we definitely keep in mind that within every other project, there is a certain competition, of course. One of the most important programs for us in this case is HERA program. This is because that very much focuses on prevention and preparedness. Some other pillars is health promotion and health prevention, oncology, healthcare system and medical staff. Marina already talked about that, talked about staffing, and digital technologies, IT technology. This is something which is very much supportive to the general functioning of the given program. Direct grants and open competitions, well, this is something I talked about that. As a national coordinator, whenever there is a competition available, we usually organize a call to inform our colleagues, the very wide public about that. We say that there is an opportunity really to submit your applications if you are, let's say, an association, university, or an institution. And this approach very much strengthens the direct grants. So whenever there is a direct grant on some oncology-related issue, usually there might be some additional open competition called for. I talked about the implementation already just a bit, but to give you the general understanding of the process, I would like just to say that that is time-consuming and attention-consuming. From the point of calling for grants till the moment where you actually submit your application may take something like a whole year, a whole 12 months.
And there will be 3 rounds of announcements, but every year this happens in a different modality. Last year, for example, since the program was endorsed with delay, there was only 1 round of disbursements and thus we nominated our institutions respectively. But when it comes to funding, there are also some nuances, and I believe that our colleagues from European Commission treat this as a regular routine. But the importance is that out of the amount of this grant, only 80% will be reimbursed, and 20% will be co-funding of the applying institution. In other words, the implementing agent has to contribute 20% out of 1 million total budget. Then the net amount you are going to receive would be 800,000, while 200,000 would be your own co-funding share into this joint activity. And that would be additionally to the contributions made by the countries, on top of that 20%, I mean. In other words, in these negotiations, every country is very closely and precisely monitoring the budget. What has been announced? Has all the entire amount been announced? And whether all of the commitments have been delivered to. And there is a lot in terms of very close monitoring, and compliance monitoring is part of that. So again, there are different types of reimbursement prior and following the audit, and then the final audit to monitor the implementation results of the entire project. But speaking of our successes and accomplishments, in 2023 and 24, we have applied and currently implementing 14 different projects. The total budget confirmed would be 8.84 million euros, including this 20% of our co-funding share. And that means that 4.37 million euros of live funding arrived to Ukraine, which means a lot in terms of cancer prevention interventions. And I have to admit that this was a particular area which was deprived of the focal attention which this sector does deserve. But this also is making sure that we can redefine our priorities, making sure they are aligned with the European ones, and the respective priorities are set in Ukraine. And here you can see the total number about the experts and manpower involved. And looking into some particular projects which are implemented, as you can see, they are listed here, covering cardiovascular diseases, cancer prevention, prevention of other NSAIDs, antimicrobial resistance is extremely important. So I hope you have the same slide on the big screen, because indeed these names mean a lot, as well as the numbers next to them. If you're interested in more detailed information, please visit our website, because there you will receive more detailed information. Sewage water management, mental health, dementia, which is another underestimated in terms of its value and significance areas. And again, approaching that in terms of respective priority setting was a challenge in itself. But this is not only the challenge of the modern day, this is also looking and taking that into the future. Speaking of the most recent applications, last year we filed 14 applications for different projects, with the anticipated budget being 2.42 million euros, and we are preparing to start these activities. Among those who will be implementing the grants, we have the National Cancer Institute, Public Health Center, the national one, Ohmedit, then the electronic health, I mean state enterprise electronic health, and also that will be the Center for Disaster Medicine. What is the full name of the Center for Disaster Medicine? Please remind me, thank you. And flipping the page to EU for Health, we together with different partners and equally to other countries working in different areas which are announced for respective disbursement rounds, but at the same time setting our own agenda, sometimes defining those goals which are referred to in this section in the Article 28, tobacco, cancer, epidemiological surveillance, prevention of non-communicable diseases, mental health, of course, and AMR too, as part of that. So with that, let me finish my presentation, but please stay tuned because we will have more news to share with you, and we also will be happy and interested to share our best practice in that regard. One small contribution on my side, if I may, which is to explain why are we describing these opportunities here. The fact is that we have only 2 years left. By 2027, we have to introduce, update, adapt, improve our legislation and harmonize it fully with EU acquis by 2027, full stop. And by 2030, the expectation is that we will access the EU family. These are the timings. But it would be erroneous to believe that joining the EU family will solve all of our domestic problems, because we have to design and implement and manage properly all of the implementation processes in the country. And these opportunities, these grants, these projects allow us, enable us, and empower us to improve our skills, competencies, and policies, as well as practices, just like other EU member states, because they are building strength within themselves to make the EU family stronger. Thank you so much. And with that, over to you, Madam Olga. Can I have the clicker, please? Well, first of all, I would like to express my appreciation once again for the kindest invitation to take part in this event. As a grant manager, I understand what it means when such big-scale project is being completed. And congratulating the Ministry of Health, the Public Health Center, all of the beneficiaries with this successful accomplishment of the project. And looking into the summary of materials shared prior to this event, I was really impressed. And I'm happy to congratulate all of you on that behalf. I represent the National Foundation for Research in Ukraine. And being the executive director of this institution, we are providing grant support to different research interventions and activities in Ukraine and beyond. And our principal value is being freedom from any kind of differentiation when it comes to inclusion of areas for surveillance and granting. We also provide a lot of granting support to initiatives and projects in the field of science and practice when it comes to healthcare sector. But today I'd like to focus our attention within the framework of this particular panel on those grant opportunities which are offered by the biggest in Europe, looking at the scale and gravity, and that would be the framework program Horizon Europe. Why is it important? Speaking on behalf of the National Foundation for Research of Ukraine, since 2003 we have a representative office of the Horizon Europe represented in Ukraine, providing professional advice and support to all of those who are planning to apply for grant support as part of this framework opportunity, or maybe those who are involved in implementation of different projects at different stages of that, initial and follow-up, in the progress of project implementation. And I believe that many of you are familiar with this flowchart visualization, which represents the clusters for the subject areas for particular topics, where European Union, European Commission is offering grant support. As you can see, health occupies a center space, primary space at the top of the pillar too. But what's also very important to understand is that the competitions which are announced in the health sector, they are not limited to Pillar 2 alone, which means that such clusterization in many instances are also designed in a horizontal manner, not only as a silo, which means that any potential applicant to the Horizon Europe, meaning the researchers, designers, innovation drivers, they would be and should be paying their attention namely to this particular cluster in the second domain, in the second pillar. And now looking at some numbers of statistics. Statistics are very important as the driver for our motivation, particularly if you've not been motivated enough to make your application either directly or as a consortium, because indeed there are many processes ongoing and there are opportunities that you can potentially benefit from, and such grant funding support is quite sizable. And I do agree with Madam Marina that we should be quite frank and fair in this respect, because when you have a situation of limited resources, and many countries also experience some hardship, just like Ukraine does. And thus, availability and accessibility of grant funding is one of the drivers of not only, and here I fully agree with you about making sure that you have some tangible assets to be mobilized, but most importantly, that is development and evolution, cooperation with your colleagues, with your peers, at the highest professional level. And thus we have to appreciate that since the start of the Horizon Europe implementation, either in progress or accomplished, total number of 10 projects falls under the subject area of our discussion today, with a total budget exceeding €1,800,000. What's also important in this regard, similar to the EU for Health program, and this is nice to be sitting with you in the same panel and speaking the same language, because as you mentioned, distribution of funds between different projects is different, time scale for implementation of them is different as well. And thus we, speaking on behalf of the Horizon Europe and others involved in European integration promotion, we would like to make sure that the family of coordinators is growing, because coordination is challenging, both at the time of filing your application and also at the stage of implementing the project, including financial coordination. But we have to develop this expertise. Hopefully, the number of Ukrainian organizations, not just regular consortium members, because that means smaller amounts of money, but accessibility of resources and coordination of them has very strong advantages, because in that case, you as coordinator can also be building some policy, designing the architecture of the project. With that in mind, please consider that quite seriously. Definitely, I will not be reciting every name and number, but here you can see some overall statistics against those organizations that were representing Ukraine as members of such consortiums, and also the financial resource that became accessible for their benefit via success in different competitions announced by the Horizon Europe. But again, please pay attention to the subject areas covered. And here you can see the public health center represented, but there are also some private health institutions. And remembering that the target audience of the Horizon Europe program are researchers and innovative technology designers, including startups on the one hand, but also medical universities on the other, which is a very positive sign and even a trend. These are some snapshots of the projects which received the funding and are implemented as part of the Horizon Europe intervention. And as you can see, there are different subject matters covered, 2 of them dedicated to cancer, and later on I will provide you with detailed overview regarding those particular interventions. This is not the matter of outlining some particularly remarkable project, but while preparing for this conference and this particular panel, I would like to refer to a particular consortium as an example, with the Center for Public Health being the partner. PIECES is the title of the project, which is aimed at prevention of cancer, which is the centerpiece of this consortium. And this is exactly the case when such serious partner acting on behalf of Ukraine is pursuing those objectives which are of critical importance at the national level. In other words, this is the demonstration that such projects, once they are planned appropriately in a professional manner, can be targeting very substantial thematic domains and areas where country resources are scarce. Also, there are different missions of EU which are covering those horizontal bonds within the flowchart. One of them would be the EU mission Cancer, the Cancer, which is quite specific in terms of its goals and objectives. I believe I should not be speculating in that regard any longer, but the important thing is having the cross-sectional priorities, in particular equal access for everyone, personalized healthcare, innovations, and pediatric cancer care. And these are shared in a cross-sectional manner, not only in Ukraine, but in the entire European space defined by European Commission through 2030 is one of their cross-sectional priority. So please consider that when making your application or accessing any collaborative opportunity. Now, speaking of some important milestones and the dates, starting with May this year, and thus on the 5th of May, which is soon enough, we will have a brokers event. Let me explain what a brokers event is. Brokerage event is a kind of a networking platform for the future consortiums. So it's quite potent and important at the same time. So brokerage, as you know, is a title used in business glossaries, and that will be followed by the major information and awareness building day on the 22nd of May. And it will be dedicated to searching information, any kind of information, including some online references. It will be held online, so do visit our website. By the way, we have the planner with designated dates for different events for your convenience. So we will have quite a rich and saturated agenda if you directly or indirectly interested in seeking funding from the European Union sources, particularly in the health cluster. Another important accent to be emphasized, which is again part of the framework Horizon Europe for Ukraine, we have the innovative component, and there are some programs which are motivating the innovators, designers, and researchers to come together, but there are also some innovation-specific initiatives. And this initiative in the health sector is also one of the competitions implemented by the EU, particularly as part of the health cluster. And thus, anyone who has some innovative ideas and a connection to innovations in this professional field for health applications, you also will find a place and time here.
And now there is a bit of information dedicated to competition, which are going to be called for very soon in 2025. Well, you have all this information on the slide, so I don't want to go deep into that. Some of them have won cycle, the others have 2 and more, some of them have a longer submission period, the others have shorter, but I do hope this information is going to be very useful for you in 2025. A bit of information about strategic objectives. That's basically the continuation of the previous slide. And one more cycle for the health cluster. That one has already started. So basically the submission process has been open. And I guess you had the chance to pay attention to a rather high amount of funding that could become available. These are the topics. And just to conclude with, let me also briefly touch upon a short update. The European HDA agency, and you definitely understand you cannot go on without digitalization in health, is launching its own competition and cycles. You can see how big the budget is, which is managed by the given agency. And here you can see some cluster topics which are available to, which could be used to gain some additional opportunities. Colleagues, this is it from my side. Using this QR code, you can go to a website where we have relevant information for Ukrainian innovators and educators. And with that, I would like to thank you very much. Thank you very much, Olga. Thank you very much, everyone. Thank you very much, colleagues, for your presentations. It looks nice and good and rich looking. Let me call it that way. But to my mind, could you tell me, what are the most common mistakes that people make when submitting their applications to this or that project? I would say it's not about making a mistake. Maybe it's about lack of understanding how these processes actually work in the European Union. Because the EU approaches are quite, very well weighted. They usually take a lot of time to make a decision. In Ukraine, you can do lots of stuff, during the same period of time, and they make one move only. So sometimes you end up with a feeling that you kind of underperform, but it's just because you are moving fast. Another challenge which I had is English language. That's a must-have. And time, of course. You need to have enough time for meetings, and experts talk in a very expert way. They talk about some really deep details and aspects, and in parallel you have some other tasks waiting for you. But what we have to bear in mind, and we need to understand, is that that's about our future. So when we become the members of the EU, we need to be fully adapted to these challenges. We need to focus on them. We need to work very substantially on these issues. So 2 challenges, as I mentioned: time, and maybe you feel like running on the same spot, and you need to stop sometimes to look around. And this is also English. That enables you to speak one language, one expert level language, and also to go on with networking. From our side, when we joined one or several initiatives, we could see that additional initiatives would, grow from that, just because you were directly involved. The Ukrainian perception is that you want to have it now and right here. No, it doesn't work like that. You need to be patient enough, and if you submit it today, maybe in a year period of time you will get something. So you need to, to give it some time. You need to talk the same language, and you need to apply efforts. Olga, do you want to add something? Well, of course, the National Research Foundation of Ukraine is also a granting agency, so we know your pains. And many people in Ukraine started thinking that these grant opportunities is really something good. And the challenges that I see is, number one, a psychological part of it. Probably that's because of lack of knowledge and maybe because of lack of certain level of trust. Basically, people do not believe that in a sincere, trusted manner you can get some reliable funding. So you're talking about corruption risks, embezzlement, stuff like that? Not really. When we talk about grants from European Commission, you can hardly talk about corruption. I would say it is about lack of trust that it has become possible. It is possible for you, for Ukraine. But maybe you're partially correct. That's the, post-Soviet syndrome, post-Soviet devil inside, sitting inside and, asking those questions to you. And I keep repeating that this grant-related activity, especially in the field we're talking about today, is a rather complicated type of work. So without sufficient resources for management, it will not work. And the management should start not during the program implementation. People need to know how to do, what to do, where to find information. And if you invest your human capital and you apply for a competition which does not fit you, which you're not eligible for, okay, that leads to a total frustration. You spend your time in vain, you spend your efforts. That is why you are talking about professionalization, about access to information, the proper pool of people, English speaking, knowledgeable about granting mechanisms, EU or European Commission granting mechanisms, which is not the only source, but one of rather substantial ones and accessible to Ukraine. And one more important component is looking for proper partners. Because during the assessment phase, especially when you're talking about this Horizon Europe office, we're always talking about consortiums. So looking for the proper partner to get the high-level assessment score from experts, it gives you like 50% of success. And the last thing to mention, let me share this experience with you. It is totally okay when you decide to make your first step, you submit your application, and it does not work. It's fine. It's fine. You just look into the, claims, you look into the comments and the remarks, which are going to be provided to you as a feedback. You just learn from that, take it as a lesson learned. Do not take it as the end of the world. It's not the end of your grant life. Let me add a couple of words about corruption. Well, we have some projects which people do not want to apply for. We have like a 4-year project for a total sum of 40,000 euro. And if you break it down into monthly parts, it's totally, negligible. It's very small. But that's about kind of testing, about piloting your idea somewhere which is still alive, somewhere deep inside you. Do not refuse from that. Then when you go from one project to another, you learn, you get experience, you can see a wider picture. Maybe it's not the proper way to say it this way, but let me mention that you don't need to go for a high sum of money. Go for the good idea. There are multiple institutions, multiple agencies. They have small-sized grants or ideas that can enable you to better understand these practices, to analyze, to make some small reforms or reformations, and then you end up with something good. Let me add, the grant is not about money. It's not about, granting you money. A mistake many people make is that they think, well, if I take a grant, that means I will take the money. No. Winning a grant is about work as a team, about work as a consortium, work with your partners, continuous cooperation. But money, in this case, is like a secondary role. It's not the main role in this case. I know some people who would think like, okay, $100,000, but then when you get it, you forgot about the project, you forget about implementation, you forget about people. No, that's not the way it should be done. That's about joint implementation. And Olga says, and responsibility. When you take part, when you submit your idea, come on, take the responsibility. You mentioned, don't be afraid of small grants. You go from one project to another project and stuff like that. We keep talking about cooperation with European colleagues today, and we're thankful for their support. Maybe the organizers will not like my question, and it may sound very undiplomatic. But we know there were some grants supported by US colleagues, and in the beginning of the year, they just disappeared. How sensitive it was, and to what extent the competition has increased with regards to the presented projects from your side? Probably that was a question to me. Marina says, let me start with that. In the field of healthcare, and especially if you talk about some cases that I was working upon in the recent years, I have to mention an important thing. I did have my people working within this USAID projects, but when the funding was suspended, was frozen, well, the projects did not stop. And you know why? Because we already had institutional capacity to go on. We already used the grant-provided funds to create that sustainability. So we improved the institutional capacity, we pushed it forward, and then it could go on. So I think this is something that needs to be very much focused on. And staff, yeah, we have some staff available now. Let me speak on behalf of the Ukrainian Public Health Center. We used to be, and we still are, the beneficiaries to multiple projects. And when a series of USAID-funded projects were terminated, let's say we could feel it, but that was not critical. So the processes we had running, they are still running. Some priorities have been, well, reprioritized. Some decisions were made, but we're still running. We started this EU for Health 3 years ago. We joined the project, and that looked like, and it looks like, still a very good opportunity to differentiate. A lot of ideas have been implemented as our daily practices in the Ukrainian Public Health Center. Some other things we review. Some things could be implemented not during 3 years, but 5 years period of time. But I have to say, all the initiatives that have been started, they still continue to be implemented due to this differentiation. I guess maybe we were just quite lucky in this case. Colleagues, do you have any questions? It seems like our speakers are very open-hearted today. They are very sincerely talking about everything. So use your chance. René, you have a question.
Yeah, it's not a question. By the way, heads off to the tough questions. I leave that to you. It's more Churchill. You mentioned twice the English language. I give the treble whammy. Please, this is vital. You cannot say, well, you can read between the lines and the evaluators will understand what I meant. No. Having said that, you don't need to be Shakespeare. Give it to people who are not involved in the preparation of the proposal. Let them read it, and if they understand it, experts will as well. But if they say, imagine an expert reads hundreds of pages in a short time and they're looking for specific information. They don't fill puzzles in and try to guess. So please, I'm very happy that you mentioned it twice. Now you hear it the third time. English is an issue. Other thing that I wanted to mention, start, and again, you mentioned it twice, start small. Try to be part of another project that is led by somebody where you have a specialty. And don't be shy if you're only in for 100,000 euros. It's a first step. And then you learn and you read everything carefully. Another tip, please dedicate people to the administration. If you're the top expert in something, you cannot be the top expert in administration. Dedicate somebody who takes care of all the paperwork. And don't say, it's a rainy Sunday afternoon, I'll take care of this. This is disaster. And that goes a bit of when we have actually problems. It's not corruption or so, it's mostly that entities don't fill in the papers correctly, and we have to ensure that taxpayers' money is correctly spent. So please, dedicate staff right from the beginning. And now the top tip, there is a database where the European Commission collects expert CVs. And the best way to learn how to write good proposals is to evaluate them. The Ministry of Health, in particular Marina, she can share the link afterwards. You sign up as an expert. And as always, doesn't mean that tomorrow somebody calls and you will be chosen. But if all of you sign up for your areas, Ukraine will send some of you to Brussels for evaluations, or we're doing remote evaluations as well. And when you see the mistakes that others are making, then you can learn for yourself. So please participate as experts where you evaluate project proposals, because it's a good learning expertise. And one very last thought, again, Churchill, because you mentioned it twice, read what you get back from failures. We spend a lot of effort in ensuring that all your marks are reflected in the comments. You can find all the information why you didn't get funded in the comments. So for example, classical mistake, outreach. It's normally what people write in the last minutes before submission. And when it says sorry, it's not enough to say that you have a website and you will do a conference. What we need to read is, what information will you provide on the website? For whom? Specific experts, the general public, the young generation, who is, by the way, quite numerous here in the room. Specify this. In which language? If it's something that focuses in Ukraine, will you also make information available in English so that your partners in the EU can read it? These are little things, but we have seen great research ideas, and they didn't get funded because these things like outreach, communication, management structures, by the way. Very often, if I'm the super expert, I have a brilliant idea, where is the money? And then the project gets not funded because there is no management structure. It's not clear how the partners work together. My favorite is conflict resolution. This is not a wedding that guarantees a happy life forever. You might have troubles in the project, so specify in the proposal if there will be a steering committee, what you do with voting, how the voting rights are distributed. It seems boring when you have this brilliant research idea for the Nobel Prize. But this is what we need to guarantee that taxpayers' money is not misspent. Sorry for this long intervention, but I just wanted to underline the best presentation that I've ever seen on Horizon Europe.
Дякую, Рене. Але тим не менше на
Thank you, Renee. And nevertheless, if you visit the website of the EU delegation to Ukraine, you can also find a lot of helpful information about the projects, grants implemented, expected and other collaborative opportunities, and we are thankful to the EU delegation for making that information available. And thank you, dear friends, for extremely helpful informations, for being so open, so detailed, so constructive in your advice. We definitely will find that as a very strong motivator to the potential applicants. And speaking of both potential and actual applicants, feel free to enjoy these opportunities. With that, we are closing our panel, but first let's make a quick family picture. Thank you so much. And with that, I'd like to invite Miroslava Daiduch, Sectoral Coordinator for Health and Social Welfare, for the benefit of closing our conference today. With your permission, I will not use the entire 15-minute slot as suggested by the agenda, because everybody is quite tired. But I do have a very quick announcement to make, following up on what Rene said. Yes, Google Translate does not apply. And also, this might sound challenging and boring, but please read the terms of references appropriately and answer every question, making sure there is a clear bullet point answering each of the question items. Be accurate, be precise, be open and transparent. So that will be working for your benefit. And on that note, I would like to announce the closure of our conference. Thank all of the organizers, the panelists, the guests and delegates who really helped us to make our discussion here today full in terms of content, full in terms of emotions, full in terms of expectations and accomplishments. And thank God this was not just a regular tick in the box routine event that you forget as soon as you step out of this building. I will not be repetitive about the project expectations and project accomplishments, but all of those gains, all of those norms and systems, legal bills that has come into action thanks to that is now part of our reality. And this is the deliverable with capitalized letters signifying the importance to that. And what's important about the EU-funded projects is that sustainability, because they not just get sustained, they get persisted in terms of follow-up actions even after EU funding expires. And definitely we have a lot to do. You know that better than I do. But I have to admit that over the recent time, this would be one of the biggest in terms of visibility, effort, level of scope and level of benefit project implemented by European Union. We also have very helpful initiatives, particularly in the rehabilitation sector. Up until last year, we also worked in the area of overall sustainability and resilience, supported by the World Health Organization. And I hope this is not the last project in the pipeline of intervention supported by the European Union when it comes to European integration, public health, health sector in general. And definitely we'll have to look and see what more opportunities we have for the future and how that will be evolving as part of our cooperation. And on that note, let me thank you for your attention. And thanking you, dear Miroslava, I believe that now we can officially deem the conference event closed, but coffee and cookies and cakes. And yes, if you have any questions which you didn't find appropriate to ask to the panelists, feel free to discuss them during the networking event, which is another important item in our agenda. And on that note, thank you once again.